Right. So a very good evening to all of you. So we people have come over here to discuss the previous year questions which were asked in your NEET PG exams in last 5 years. So myself, Dr. Saurabh Bhatia, and I'm your pharmacology guru at DBMCI. And guys, I would be discussing the answers of the questions. In case you want the further clarification of any question, just let me know. Right. So a very good evening. So in case you people have any doubt, so just let me know. Accordingly, I will explain the question in detail in case you want. Yeah, hi. Yeah, I can see. Yeah, you people have joined us on the YouTube chat. So Dr. Zufi, Dr. Shikha Yadav, Dr. Sildena Phil, Dr. Ganesh VS, Dr. Dia Goswami. Yes. Hi, Dr. Vijay, Supriya, Malika. So warm welcome to all of you. So let's start with this discussion. Yeah, Dr. Malika, good evening. So the question number one, which was asked in NEET PG 2023. So, NEET PG 2023. So they have given you one graph and they have shown you the ECG changes and they've asked you which medicine can cause or which medicines can lead to these changes. So we can see in this ECG changes, the patient will have the tall T waves. So patient can have the tall T waves. And if I say the patient is having the tall T waves, so tall T wave is a characteristics of hyperkalemia. So patient is suffering from hyperkalemia. So, so if you have to find out which medicines can cause hyperkalemia as a side effect. So the question is which medicine can cause hyperkalemia as a side effect. So here the answer is spironolactone. So spironolactone is a potassium sparing agent. This medicine can cause hyperkalemia as a side effect. So if any patient is taking this medicine, would be responsible for this tall T wave. So patient is taking some diuretics, right? And they are asked which diuretic can cause tall T wave or hyperkalemia. So answer will be spironolactone. Now question number two, the patient is having the recurrent attack of gout. So patient is having recurrent attack of gout and we have started on a medication that inhibits uric acid synthesis. So medication that will inhibit uric acid synthesis and after that the patient symptoms will reduce. So patient symptoms will reduce and the medicine is inhibitor of uric acid synthesis. So which drug is started? So which drug is started that can stop the uric acid synthesis so that after that the patient's symptoms will be relieved. So here in this question guys, we know that allopurinol is a xanthine oxidase enzyme inhibitor. This is the drug of choice for gout. So this medicine is the one out of these four which can inhibit the uric acid synthesis. Now in this MCQ, if they will ask you which medicine is the best medicine for symptomatic relief, if they will ask you which medicine can give only for the symptomatic relief that will not inhibit uric acid synthesis, then your answer should be diclofenac. So diclofenac is drug of choice for acute attack of gout and allopurinol is the best medicine for maintenance treatment of gout. So depends on the framing of the question. You can mark the answer accordingly. Now question number three, a patient is presented in emergency department with paroxysm of cough, fever, and the patient TLC count is very high, where the lymphocyte count is particularly high. So what is the ideal management of this patient? So in this patient guys, the patient is the one that suffers from, yes, so this patient is suffering from whooping cough. So patient is suffering from whooping cough. The patient is a case of body-tulla pertussis. So patient is suffering from body-tulla pertussis infection, whooping cough. That's why this is a paroxysm of cough and high-grade fever. Now, guys, best medicines for whooping cough is macrolides. Like if I can remember this question, the students told me in this MCQ, they have particularly asked you, there is a 3-week-old baby. So 3-week-old baby is having this problem. So if the question particularly say the 3-week-old baby that is less than and equal to 21 days of the age, less than and equal to 21 days of the age, then the azithromycin is a drug that is safe. But if the patient age given as more than 21 days, you can mark any of the medicine because azithromycin, clarithromycin, both are macrolides. So these two macrolides can be given to a patient who is more than 21 years of age. So here you will mark azithromycin as per my memory. Students told me that in question they have asked you a child of 21 days old, right? So that's why the answer is azithromycin. But if the age is above that, you can give any of the drug, azithromycin, clarithromycin. Now, question number 4, patient is a case of schizophrenia, and this patient did not respond to haloperidol. And the patient who did not respond to haloperidol or the thioridazine, so this patient suffering from refractory cases of schizophrenia. So this is the refractory case of schizophrenia, and for this refractory schizophrenia, we people have started a drug A. So we people know that what is a drug of choice for refractory schizophrenia. So drug of choice for refractory schizophrenia is clozapine. So it means the drug A is clozapine, which you have started. It's a drug of choice for refractory schizophrenia. Now after that, guys, psychotic symptoms improve, but patient develops the side effect like the cyalluria, dyslipidemia, and weight gain. So clozapine is the drug that will cause maximum metabolic side effect among all. And one of the unique side effects of this clozapine is cyalluria. So they're asking which drug you have started as a drug A. So obviously the answer is clear-cut, clozapine. Now one of the important side effects of clozapine is agranulocytosis. One of the important side effects of clozapine is agranulocytosis, and clozapine is a drug which is a drug of choice for refractory schizophrenia, which is not responding to the usual medicines like haloperidol and thioridazole. So question 4, answer is B, Bombay. Now question number 5, a patient was given digoxin, and patient has got side effects like nausea and vomiting. Now the serum digoxin concentration found to be 4. So guys, let me tell you, like if I talk about the digoxin concentration in CHF, in digoxin concentration in CHF is between 0.2 to 2.0. Right, so the level of the digoxin that we maintain in CHF is between 0.2 to 2.0, but now the level has become 4. It's more than the double the desired level. It means the patient is in toxicity. The patient has got the toxicity of digoxin. That's why the patient is getting the side effect like nausea and vomiting. Now you want that concentration should come back to the normal range. Concentration should come back to the 1 nanogram per ml. Right, now how it is possible? Now how much time you people have to wait? So digoxin half-life is 40 hours. So if I say that today the level is 4, they have given it. Now after 40 hours, this level will reduce to 2. The level will become 2, and after next 40 hours, the level will come down to 1. So you want to achieve 1 nanogram per ml, that will come in the desired range. And now you can continue with the low dose of the digoxin after that. So you have to wait for 80 hours. So if you wait for the 80 hours, then this level is reduced to 1, and after that you can continue with the low dose of digoxin. So question 5, answer is B, Bombay. Question number 6. Question number 6, a patient presented with anxiety, restlessness, tremors, and fever. So patient has got anxiety, restlessness, tremors, and fever, and BP is very high. Patient has got some arrhythmia detected on ECG. Now he has got a neck swelling. So guys, it's a clear-cut case of thyrotoxicosis. It's a clear-cut case of thyrotoxicosis. Patient has got a neck swelling, and because of neck swelling, patient has got this anxiety, restlessness, tremors, fever, high BP, atrial fibrillation, all the symptoms. Now, which medicine you can give to this patient as the next medicine? So guys, we know that drug of choice for thyrotoxicosis is propylthiouracil. But in this patient, because this patient of thyrotoxicosis has come to us in thyroid storm, these are symptoms which say that it's a very acute form of thyrotoxicosis. So here we have to take care of these symptoms also. So our first priority is to stabilize the patient. So whenever we have to stabilize the patient, we have to take care of all the symptoms, and then PTU is the one that will reduce the level of thyroid in the body. So PTU is the best medicine that will reduce the level of thyroid in the body, but first priority is to stabilize the patient. Now to stabilize the patient, we have to give the propranolol. So propranolol is a drug of choice that is given along with PTU. So propranolol is the fastest acting drug. It's the fastest acting drug that is given to control the patient, to stabilize the patient along with propylthiouracil. You will give propranolol. But in this case, propranolol we cannot give because propranolol belongs to generation 1, and generation 1 beta blockers can cause bronchospasm as a side effect. And because generation 1 medicines can cause bronchospasm as a side effect, I have to achieve the beta blocker property. Like I have to achieve the sympatholytic property, because propranolol is given to control the sympathetic symptoms like anxiety, restlessness, atrial fibrillation, high BP. All these symptoms can be controlled by beta blockers. But in this case, I cannot give the propranolol, which is a beta blocker of choice in thyrotoxicosis. So I'll switch to the other forms of beta blocker like esmolol. Right? So esmolol is the one that we prefer in this patient. Right? So question number 6, answer is esmolol. And guys, please remember, in this patient, the patient is having the fever. And for this fever, we give paracetamol as a drug of choice. So the paracetamol is a drug of choice for the fever that is seen in patients of that is seen in patients with thyrotoxicosis. We do not give aspirin because aspirin can further increase the level of thyroid in the body. So all other NSAIDs are contraindicated. Only paracetamol is given as a best medicine for fever. So question 6, answer is A, it is esmolol. Now question number 7, in patients of malignancy, platelet count is reduced. So platelet count is reduced because of the chemotherapy cycle. So which medicine is given to increase the platelet count? So guys, natural growth factor of platelet is opelvikin. Natural growth factor of platelet is interleukin 11. So natural growth factor is interleukin 11, right? So why not D? Okay, in previous question, the D is only been given when the beta blockers cannot control atrial fibrillation. So when beta blockers are not able to control atrial fibrillation, then the diltiazem is added. So diltiazem is an add-on drug. Diltiazem is an add-on drug to the main therapy. So in case beta blockers are not able to control the arrhythmia, then we will add the diltiazem. Otherwise we give beta blockers to control the sympathetic symptoms. Right? So here the answer is A, better answer. Right? Esmolol is a beta blocker. It's a selective beta blocker. Esmolol is a selective beta blocker. It is not a generation 1 beta blocker or non-selective that will cause bronchospasm. So we will choose esmolol as the best answer. We can also choose metoprolol. We can also choose metoprolol for the alternative answer, right? Metoprolol, esmolol, these medicines we can use as a best answer here. This is a confirmed answer, guys. There's no doubt in this. Now, diltiazem is not the main drug. Like you have a main drug in front of you, why you want to switch to the second line drugs, diltiazem? Better to give the main drugs like esmolol, metoprolol, all these medicines, right? Beta blockers are the best medicines, the first line drugs for thyrotoxicosis given with PTU. Why you want to switch to diltiazem, right? So here the best answer is esmolol. Stabilize the patient by giving esmolol. Immediately after that, give PTU also. Right? That's why the answer is no, Dr. MGP. Here the propranolol is not marked because of the bronchial asthma. The issue is bronchial asthma. That's why they have specifically given the history of bronchial asthma. Like if the examiner has given you the history of bronchial asthma, it means examiner wants to know. Like India wants to know. Similarly, the examiner wants to know that whether the student knows this thing, that generation 1 beta blockers are not given in bronchial asthma or not. Right? So that's why here the answer is esmolol. Yes, if there is no bronchial asthma, guys, propranolol. If there is no bronchial asthma, you give propranolol to control the symptoms. Propranolol is also an antiarrhythmic drug. Na? Propranolol is also an antiarrhythmic drug. Beta blockers are class 2 antiarrhythmics. They are the wonderful drug for atrial fibrillation. They are the best medicines to control the rate of atrial fibrillation. Okay, so guys, here the medicines which are given is interleukin 11 analog. Interleukin 11 is a natural analog of natural growth factor of platelets. And opelvikin we can give. We can also give the medicine like romiplostim. Romiplostim can be given. And we can also give the medicine like L-trombopeg. So L-trombopeg, romiplostim, these are the three medicines which are known as TPO. That is a thrombopoietin receptor analog. So they are the thrombopoietin receptor analog, TPO receptor analog. We call them TPO receptor analog. So this is the answer. Question number 7. Answer is B. Right. So question number 8. Which of the following anti-arrhythmic drug can cause pulmonary fibrosis? So pulmonary fibrosis is caused by amiodarone. So amiodarone is a medicine that will cause pulmonary fibrosis. Other side effects of this medicine are liver fibrosis. So this medicine can cause pulmonary fibrosis, liver fibrosis. This medicine can also result in skin pigmentation. So medicine can cause blue pigmentation of the skin, and this medicine can also lead to side effects like the medicine will deposit in cornea, can result in corneal deposits, can result in optic neuritis also rarely. Medicine can cause optic neuritis. So answer here is A, that is amiodarone. Now question number, these are the 8 questions asked in 2023, but we had other questions also, guys. There are 23 questions asked, but I think those questions may have gone to some other subjects. There were total 23 questions in 2023 exam. Now NEET PG 2022 exam. Let's see how many questions were there. So question number 1. So question number 1, a 14-year-old girl was given IV Botox. Now guys, I don't know why they have given IV Botox, because Botox is the one that is mainly given by the local route. So Botox is avoided to be given by the IV route. Otherwise, there is a risk of toxicity. So what will happen? Botox mechanism of action is this will inhibit the presynaptic release of acetylcholine. This will inhibit the presynaptic release of acetylcholine. So question number one, answer is A. It inhibits the presynaptic release of adenosine. Sorry, it inhibits the presynaptic release of acetylcholine. So question one, answer is A. Now question number two, what is a drug of choice in acetaminophen overdose? So acetaminophen, guys, paracetamol, they are asking the antidote. They are asking the antidote of paracetamol poisoning, that is N-acetylcysteine. So N-acetylcysteine is the antidote of paracetamol poisoning. This is given when the patient will come to you after 4 hours of ingestion. This is given when the patient comes to you after 4 hours of ingestion, or patient has come to you anytime after consuming paracetamol with life-threatening symptoms. So patient has come to you with life-threatening symptoms anytime after overdose, or patient has come to you with just mild symptoms with 4 hours duration have been passed. So answer here is N-acetylcysteine. Now guys, carnitine is the antidote of sodium valproate. Carnitine is antidote of sodium valproate. Flumazenil is antidote of benzodiazepine and the zolpidem. It is an antidote of benzodiazepine and the zolpidem. And fomepizole is the antidote of methanol poisoning. So fomepizole is an antidote of methanol poisoning. So question number two, answer is A. Yes. So before 4 hours, we can just go for gastric lavage in case the patient is stable. Patient is not having many symptoms. Good. Dr. Stith talks. You always talk good. So question number three, a young female who is having the throbbing left-sided headache, only one-sided headache, unilateral headache, associated with nausea, vomiting, photophobia, phonophobia, like she is a typical case of migraine. So this is a typical case of acute attack of migraine. Now, which of the following drug can be given for immediate relief? So guys, we know that like triptans are the medicines which are meant for the acute attack of migraine. The sumatriptan is the answer of this question. The female is having the acute attack of migraine. We will give sumatriptan. Now, propranolol is a drug of choice for migraine prophylaxis. Propranolol is a drug of choice for migraine prophylaxis. So here the answer is B, Bombay. Right? Question number four. Now, question number four, which of the following drug inhibits the PCSK9 enzyme? So guys, here is evolucumab. So evolucumab is a medicine. It's a second drug of choice for hypercholesterolemia. It's a second drug of choice for hypercholesterolemia. It is a PCSK9 enzyme inhibitor. Atorvastatin is a drug of choice for hypercholesterolemia. This is a HMG-CoA reductase inhibitor. So this medicine is HMG-CoA reductase inhibitor. Evolucumab is a second drug of choice. Now there is a drug, one more drug, bempedoic acid. Now bempedoic acid is a new medicine for hypercholesterolemia. Now this medicine is ATP citrate lyase inhibitor. So this medicine is inhibitor of ATP citrate lyase. So inhibitor of ATP citrate lyase enzyme, the drug name is bempedoic acid. It's a new medicine that is given for hypercholesterolemia. Drug of choice for hypertriglyceridemia is fenofibrate. Drug of choice for hypertriglyceridemia is fenofibrate. Right. Yes. Hi, Dr. Anshul. How are you? After a long time, I've seen you. I hope you have done with your internship, Dr. Anshul. So DVT. A patient is a case of deep vein thrombosis and patient is started on anticoagulant therapy. Now, patient has been started on an anticoagulant therapy. Now, patient has got this problem. Now, this problem is known as purple toe syndrome. So, this problem is known as purple toe syndrome. This is a skin necrosis, purple toe syndrome. It's a side effect of medicine that is warfarin. So, warfarin is a drug. First 7 days of this therapy are very crucial. In first 7 days of therapy, this medicine can result in deficiency of protein C and protein S. So because of the deficiency of protein C, protein S, which are the anti-clotting factor, warfarin can result in hypercoagulation. That will result in hypercoagulation. That warfarin is a medicine that will cause skin necrosis. Now the solution is the heparin bridge therapy. The solution of this problem is heparin bridge therapy. So what we can do, whenever we give warfarin therapy to a patient, we always start with heparin, and after a few days, we just stop heparin and continue with warfarin. We continue with warfarin and we stop heparin after a few days. So heparin bridge therapy is the concept that we follow to prevent the side effect. Now, question number 6. A patient of COPD was given intravenous aminophylline. Now, guys, what is aminophylline? Aminophylline is a water-soluble form of theophylline, which is given by IV route during acute emergency. So, like during the acute attack of COPD, we can say like this way. During the acute attack of COPD, we can give aminophylline to a patient by IV route. The patient has developed the diuresis. Now, this is due to the which action? So, the action is due to adenosine receptor. So by inhibiting adenosine receptor, this medicine can result in stimulation of the CNS center. So medicine can lead to tachycardia, tachypnea. Medicine can result in tachycardia, tachypnea by stimulating the CNS center. Plus this medicine can also result in diuresis. Medicine can also result in insomnia by stimulating the CNS center. And the drugs can also result in nausea, vomiting. So these are the side effects the medicine can cause by acting on adenosine receptor. Medicine can stimulate CNS center. Medicine can cause diuresis, can result in nausea, vomiting as a side effect. So question number 6, answer is B, Bombay. By inhibiting adenosine receptor, the medicine can result in diuresis. Now question number 7, the patient, a female is a ovarian cancer. And we know that whenever we have the gonadal cancer, like males may seminoma, females may ovarian cancer, we give cisplatin. Cisplatin is one of the very good drug. Cisplatin is one of the very good drug for gonadal carcinomas, right? Now, after taking cisplatin, she has got a vomiting because cisplatin is a drug which has a maximum risk. Cisplatin has a maximum risk of chemotherapy-induced vomiting. Now, for this vomiting, guys, you people have given some anti-emetic drug, and after getting some anti-emetic drug, she has got a dystonia. So she has got a dystonia. She has got a muscle dystonia, and because of that muscle dystonia, now she is having the problem. So they are asking which anti-emetic can cause this muscle dystonia as a side effect. So answer is metoclopramide. So metoclopramide can cross blood-brain barrier, and after crossing blood-brain barrier, this medicine can block the dopamine pathway. So medicines can block the dopamine pathway in central nervous system, and by blocking this dopamine pathway in CNS, this medicine can result in extrapyramidal symptoms as side effects. So medicine can result in extrapyramidal symptoms as a side effect, and that will result in acute muscle dystonia as one of the presentation. So question number 7, answer is B, Bombay, that is metoclopramide. Now question number 8, in patients of MDR-TB, which of the following drug combination shows resistance? So which combination resistance is known as MDR-TB? Answer is H plus R. So H plus R resistance is known as MDR-TB. And guys, what is HDR-TB? HDR-TB is H plus R resistance. Apart from H plus R resistance, patient will have resistance to one of the fluoroquinolone. Patient will have the resistance of one of the fluoroquinolone, or the patient will have the resistance of two more second line drugs, or we call them class A medicines, right? So patient will have the resistance of H plus R plus one fluoroquinolone, plus the patient will have resistance of two more class A medicines, which we also call them second line drugs. So second line drugs the main drugs are aminoglycosides, linezolid, right? We have the medicine like bedaquiline. So those medicines are there. So question number 8, answer is B, Bombay. It's a resistance of isoniazid and rifampicin, right? Now question number 9. In question number 9, which of the following drug have least adverse effect? Least adverse effect on pleura. So answer here is metformin. So guys, metformin is a drug of choice for diabetes mellitus 2. This medicine will not cause pulmonary fibrosis. This medicine will not cause pleural fibrosis, pulmonary fibrosis. Rest of the medicines here will cause pulmonary fibrosis. So guys, please remember methotrexate, bromocriptine. Methotrexate and bromocriptine, these medicines are ergot derivatives. These medicines are ergot derivatives, and one of the important side effects of ergot derivative is they will cause fibrosis, right? So bromocriptine and methotrexate, they are the ergot derivatives. One of the important side effect of ergot derivative is fibrosis. That's why these medicines are less commonly been given these days. Now, nitrofurantoin is a drug that is given for UTI. Now, nitrofurantoin starts with N. So, this medicine side effect is neurotoxicity, and having the alphabet F, that will cause fibrosis. So, nitrofurantoin, you can write like this way, NF. This will cause neurotoxicity and fibrosis. Now, bromocriptine, methotrexate are the ergot derivative. They will cause fibrosis. One more important side effect of this medicine is vasospasm. So these ergot derivatives can also cause vasospasm. As a result of vasospasm, these medicines can cause gangrene. These medicines can cause gangrene as a side effect. And one more side effect of medicine is these medicines can also damage the heart valves. These medicines can also damage the heart valves. So these are the some important side effects of ergot derivatives, which are frequently asked in our exam. This is an important topic, that is ergot derivative side effects. So question number 9, the side effect is metformin. Yes, Dr. Sneha Neval. Sneha Neval? Sainya Neval. Okay, yes, the side effect of this medicine is brown discoloration of urine, but the important side effect is the neurotoxicity and fibrosis. Drug of UTI, guys, drug of UTI, we cannot say like it's ciprofloxacin. That depends ki which type of UTI is given to in MCQ. Whether it's a uncomplicated UTI or complicated UTI, depends on that we find the drug of choice. Right? So ergot derivatives can cause fibrosis. The important point here is this. Now, a patient who has developed opioid poisoning, presented to the emergency room. How will you manage to improve his respiratory depression? So guys, in opioid poisoning, the biggest risk is this only. This is the main reason for death, that is a respiratory suppression. So respiratory suppression is the biggest reason for the mortality. So they are asking which medicine is given to stop this respiratory suppression. So we have to give the antidote. We have to choose the best antidote out of that. So the best antidote, the fastest acting antidote, the fastest acting drug, the medicine name is naloxone. So naloxone is the fastest acting antidote of this medicine, right? So fastest acting drug naloxone, which is the antidote of opioid poisoning. So this medicine is given as an antidote. We discussed already flumazenil for benzodiazepine. We give flumazenil for benzodiazepine, right? And fomepizole, we people have discussed already in previous question. This is given for the methanol poisoning, right? So this is given for methanol poisoning. So question number 10, answer is B. Now question number 11. Question number 11 says 82-year-old patient. 82-year-old patient. So you can see the patient is very old, right? Now he is having the acute episode of shortness of breath. So patient has got shortness of breath. Patient has a breathlessness. Old patient having the breathlessness. Plus X-ray shows pulmonary edema, right? So it is a CHF case, clear-cut case of congestive heart failure. So patient is a clear-cut case of congestive heart failure with pulmonary edema. So this is a clear-cut case of CHF with pulmonary edema. Plus now the patient has got the high blood pressure. Patient has got the high blood pressure. So high blood pressure with acute shortness of breath, right? Now uncontrolled hypertension, because the patient is not taking the medicine regularly. That's quite often in old age. Now which medicine you can give? So which medicine we can give to this patient? Right? So Dr. Shimu, it's not the pulmonary hypertension, it's just a normal hypertension. It's just a normal hypertension. Guys, you must be knowing, whenever the patient will have the congestive heart failure, the heart will get full. Now the heart will give backflow to the lungs, and patient will have the CHF with pulmonary edema. So here you have to control the CHF, plus you have to control the high BP. We will give IV nitroglycerin. So IV nitroglycerin is a drug which is a venodilator. Basically, at this point of time, patient requires venodilator. Now, venodilators are the medicines that will reduce the preload. Venodilators are the medicines that will reduce the congestion in the heart. And once they will reduce the congestion in the heart will have the relief, the lungs will have the relief, and now the patient will not have the breathlessness. The breathlessness is due to pulmonary edema. So IV nitroglycerin is given, but if they will ask you which medicine is the best medicine for this condition, the best medicine for this condition is furosemide. So furosemide is the best medicine for this condition, but here the best answer you have to mark is nitroglycerin. You have to understand it's not the bronchial spasm, it's just a kind of a pulmonary edema causing the breathlessness. So here the best answer is IV nitroglycerin. Furosemide is overall the drug of choice. Now question number 12, the patient is a suspected case of acromegaly. So patient is a suspected case of acromegaly having the excess of growth hormone. Now why the patient will have excess of growth hormone? The most common reason is pituitary adenoma. So patient has got pituitary adenoma. So pituitary adenoma is the most common association with acromegaly, right? Now the best treatment for pituitary adenoma is a surgery. So we go for transsphenoid surgery. So pituitary adenoma, the best treatment is surgery. Now after doing surgery, we check the level of insulin growth factor. we check the level of insulin growth factor 1. So after doing surgery, when we remove the pituitary, we check the level of IGF-1. Now in this patient, if the IGF level 1 is still high, even after removing the pituitary, still the patient IGF level is high, then we have to start with the drugs. And guys, please remember the drug of choice is lenriotide. So lenriotide subcutaneous depot. So lenriotide subcutaneous depot is a drug of choice, but here the lenriotide option is not given. So we will mark the medicine octreotide. So octreotide is a medicine which is a somatostatin analog. So octreotide, lenriotide, these medicines are the somatostatin analog. So these medicines we can start in the treatment. Now after starting this lenriotide, we still check the level of IGF-1. Now if there is a mild increase in the, if there is a mild increase in the IGF level 1, then we will add the medicine in this treatment, that is cabergoline. We will add the medicine treatment cabergoline, but it is significantly high. If this is significantly high, if this level is significantly high, then we will add the medicine in this treatment, that is known as pegvisomant. We will add the medicine pegvisomant in the patient treatment, that is known as growth hormone receptor antagonist. So pegvisomant is a medicine which is a growth hormone receptor antagonist medicine. So growth hormone receptor antagonist medicine, the drug name is pegvisomant. This is added in the patient treatment, and we will also give cabergoline if the IGF level is mild high. So here the best answer is B, Bombay. Question 12, answer is B. Now guys, let's move on to question number 13. So question number 13, a 40-year-old male presented with protrusion of chin. So protrusion of chin, excessive sweating, impaired glucose tolerance, enlargement of hands and feet. Guys, again this is a case of acromegaly. So again they have given a case of acromegaly with a different aspect. Now what they are asking which of the following drug is growth hormone receptor antagonist. So I will not tell you the answer. You people have to answer yourself. Now which drug is growth hormone receptor antagonist that we will use in this patient of acromegaly? So this we have covered in the previous question. Pegvisomant is a medicine that we will give. So here they have given all the medicines names like octreotide, cabergoline, pegvisomant, which we mostly given for the treatment of acromegaly. In previous question, they have asked the drug of choice, that is a octreotide or lenriotide. In this question, they have asked the growth hormone receptor antagonist. The answer is pegvisomant. So question number 13, answer is A. Now question number 14, a female is presented with amenorrhea and galactorrhea. So she has presented with amenorrhea, galactorrhea. It means she has excess of prolactin. So excess of prolactin will lead to galactorrhea, plus that will lead to lactational amenorrhea, right? Now she is having amenorrhea, but her pregnancy is negative. Obviously, like she cannot conceive. This amenorrhea is due to hyperprolactinemia. She cannot conceive. She is infertile. Now again, the reason for prolactinoma is the patient suffer from prolactinoma because of the pituitary adenomas. So because of the pituitary adenoma, right? And you can see, guys, the patient having the macroadenoma. So if there a patient is having the microadenoma, then we can think of giving the drug therapy. But in macroadenoma, the best treatment is like we should go for the surgery directly. But patient has refused the surgery. They have given the complete information. Because it's a macroadenoma, patient has refused the surgery because the best treatment is surgery only. Now what do you do? So answer is we have to give the medicine that will stop the prolactin level. That will reduce the prolactin level. So we have the drug bromocriptine. So bromocriptine is a medicine. Bromocriptine, cabergoline are the medicines. These are the medicines that will act on dopamine 2 receptor. So these are the medicines that will act on dopamine 2 receptor, which is a type of inhibitory receptor, and they can inhibit the release of prolactin. Like in the previous question we have covered, they can also inhibit the release of growth hormone. So these are the medicines which will act on dopamine 2 receptor, inhibit the release of prolactin and the growth hormone. So bromocriptine, cabergoline will be the answer of this question that we can give to this female. So question 14, answer is B, Bombay. Bromocriptine we will mark as the best medicine to this patient. Now question number 15, a patient presented with tremors. Patient presented with tremors, rigidity, bradykinesia. So guys, it's a triad. It's a triad of Parkinson's disease. It's a triad of Parkinson's disease. So patients suffer from Parkinson's disease, having the tremors, rigidity, and bradykinesia, and having the mask-like face. So confirm the diagnosis. Now, which of the drug is used in the treatment? So which drug is given for Parkinsonism? Basically, they're asking which drug is given for the treatment of Parkinsonism out of these four. So guys, selegiline. Now, selegiline is a medicine which is a MAO-B inhibitor. This is a MAO-B inhibitor. This medicine is given to a patient of Parkinson's disease, right? So in the mild cases of Parkinson's disease, the medicines which are drug of choice are MAO inhibitors. The patients who have the moderate Parkinson's disease, if their age is less than 60 years, we will give dopamine 2 receptor agonist. If the patient age is more than 60 years, we will give the medicine like levodopa. Now, if the patient is having severe Parkinson's disease, so here we will give levodopa directly to the patient. So selegiline is a medicine for mild Parkinsonism. For moderate case, the age is less than 60 years, dopamine 2 receptor agonist. More than 60 years, we give levodopa. Now, donepezil is a drug of choice for Alzheimer's disease. Fluoxetine is SSRIs. It is a drug of choice for depression. And haloperidol is antipsychotic. It is given for the treatment of psychosis. So question number 15, answer is A. Now question number 16, a patient presented with TCA toxicity. So tricyclic antidepressant toxicity, right guys? So what are the symptoms of TCA toxicity? They have given the symptom like patient has got arrhythmia. So guys, you can remember the symptoms of the TCA toxicity with the mnemonic, that is SHAMA. So in this SHAMA mnemonic, the patient can have the seizures. Patient can have the blocking of histamine receptor that can cause sedation and drowsiness. So patient is in very drowsy type of state. Patient can have alpha blocking property. Patient can have hypotension. Patient can also have the muscarinic blocking property. Patient can have anticholinergic symptoms. Patient can have the anticholinergic symptoms like the dryness and tachycardia. Patient can also have the arrhythmia. Like QT prolongation given in this MCQ. But apart from this SHAMA, the patient also develop metabolic acidosis. Now, this metabolic acidosis will further aggravate the arrhythmia. So, if the patient develops metabolic acidosis, this will further aggravate the arrhythmia, and now the patient will die. The main reason for death in the patient is metabolic acidosis. So, metabolic acidosis is the one that will further aggravate the arrhythmia and that will lead to death. So, here we have to control the acidosis, plus we have to give the anti-arrhythmic. We have to control acidosis, we have to give anti-arrhythmic drug. So to control acidosis, guys, the best medicine is sodium bicarbonate. So sodium bicarbonate is a medicine which is an antidote of choice for TCA toxicity, but also we have to give anti-arrhythmic. We have to maintain the BP by giving the IV fluids. We have to give anti-epileptic medicines to control seizures also. Guys, please remember, in the treatment of TCA toxicity, physostigmine and the atropine. Physostigmine and atropine are strictly contraindicated. So these two medicines are contraindicated. Diazepam is given to control seizure. Lignocaine can be given to control arrhythmia. Lignocaine can be given to control arrhythmia, not the QT prolongation, but the other arrhythmias. Lignocaine can be given to control other type of arrhythmia. Diazepam for seizure, sodium bicarbonate for as antidote, but physostigmine, atropine are contraindicated. So in this question, if they will ask you which drug is not given, answer is physostigmine. Question number 17, patient has got a palpable purpura, arthralgia, pain in abdomen and melena. So patient is suffering from HS purpura. So patient suffers from HS purpura, clear-cut diagnosis they have given, clear-cut symptoms they have given. They're asking which drug is given. So guys, in mild cases of HS purpura, we will give glucocorticoids. In mild cases of HS purpura, we give glucocorticoids. But in moderate to severe cases, we can also try the other immunosuppressant medicines like the azathioprine, cyclosporine. So these medicines are given in moderate to severe cases. But in mild cases, we will give only glucocorticoids, that is steroids. So question number 17, answer is A. Very good. So HSP purpura, steroids are given. Patient will have the GIT involvement. Yes. So we will give steroids. Question number 18, an 11-month-old child having the recurrent jerky movements. The baby is having the recurrent jerky movements of the limbs, right? Now develops a regression of the milestone, and electroencephalogram shows some spikes or some unique patterns in the electroencephalogram. So guys, this is a triad that is seen in patients of Lennox-Gastaut syndrome. So this is a case of Lennox-Gastaut syndrome. But the only problem in this MCQ is the age. The age is too young, like it's 11-month old they have given. So it's unlikely to have Lennox-Gastaut syndrome uh, because like in this patient, Lennox-Gastaut syndrome mostly occurs in adolescent patient. So, but the patient is having this epilepsy going on. So some epileptic features are there, plus the lack of milestone is there, and some electroencephalogram pattern is showing some typical pattern. So this may be other syndrome. So the question is not clear, like which diagnosis we will make. Maybe your pediatric faculty can make the better diagnosis of it, right? So, but out of this, which medicine would you choose? So if I consider this the case of Lennox-Gastaut syndrome, considering the triad, out of these four, ACTH I can choose. So ACTH, although this medicine is given for mainly for infantile spasm, but this medicine can also be tried for Lennox-Gastaut syndrome, right? So ACTH will be the better answer. But for the proper diagnosis, guys, I suggest you can consult your uh, pediatric faculty for this, that he would help you in making the proper diagnosis of the disease. So question number 18, answer is ACTH as per me, because propranolol is not an antiepileptic. Phenytoin generally we don't give to children, right? Phenobarbital can be the answer, but ACTH would be the better answer considering the disorder as LGS. This is the only explanation I can give you. Now let's move on to 2021. So question number 1, patient is having the primary open angle glaucoma. Patient is a case of primary open angle glaucoma with bronchial asthma. So patient is a case of glaucoma with asthma. Which drug is used? So guys, I'm still doubtful whether the choices are correct or not, because out of these four, only one drug is anti-glaucoma drug. Only one medicine is anti-glaucoma. The rest of the medicines are not anti-glaucoma. Rest of the medicines are not anti-glaucoma drug. Gemiprost is given for MTP. Carboprost is given for PPH, and L-prostadil is a medicine for the ductus arteriosus. So when we want to keep ductus arteriosus patent, L-prostadil is given. Carboprost is given for PPH. Gemiprost for MTP. So no drug here is given for glaucoma. So I'm still doubtful what exactly they want to ask. So guys, let me tell you just for your information. In glaucoma patient having the bronchial asthma, timolol is the drug. So timolol is the drug that is avoided. So timolol is a medicine that is avoided. So timolol is a beta blocker, again a generation 1 beta blocker. I told you generation 1 beta blocker. I told you many times during my lecture, generation 1 beta blocker side effects are very important. So timolol is a medicine that is avoided, but latanoprost is the best answer here. Now they have given you a drug over here that is mitomycin C. I think guys, you people cannot read the name. So for your convenience, let me write. So the drug name is mitomycin C. This is an anti-cancer drug. Now where do we use this medicine? Topically. So guys, mitomycin C is a medicine which has a fibrinolytic property. So this medicine has a fibrinolytic property. Now, because of the fibrinolytic property, this medicine is given to prevent the fibrosis, like in tracheobronchial stenosis, right? So we can give this medicine for tracheobronchial stenosis. Now here, which is a tracheobronchial stenosis? The answer is subglottic stenosis. So this medicine is given for subglottic stenosis. Now this medicine is also given after pterygium surgery. So after pterygium surgery in eyes, we can use the medicine. So we can use this medicine after pterygium surgery. We can also use this medicine for subglottic stenosis. And guys, for the topical use, I can also give this medicine as an anti-cancer drug. I can also use this medicine as an anti-cancer drug for bladder carcinoma. For bladder carcinoma. Dr. Vibhu Arya, right? Dr. Vibhu Arya, are you from Chandigarh? Are you the same Dr. Vibhu to whom I met in Chandigarh? So latanoprost is prostaglandin F2 alpha analog. So Vibhu is asking what is latanoprost? It's a prostaglandin F2 alpha analog, right? So it's a prostaglandin F2 alpha analog. So question number 2, answer is A. So question number 3. So question number 3 is will be covered in your basically derma class, because this is a typical case of leprosy. So as a typical case of leprosy, this will be covered in your derma class, because we generally don't take this topic as in pharma. So I'll tell the derma faculty to discuss this question with you because we generally don't cover this topic in our pharma. Now question number 4, a patient with vomiting. A patient with vomiting was treated with antiemetic. Now patient symptoms are relieved, but patient has later developed abnormal. It's not abdominal, it's abnormal. So patient has developed abnormal body movements. Now again the same question, guys. That is metoclopramide. So patient has taken metoclopramide and patient has got a extra pyramidal symptom. So patient has taken metoclopramide and patient has got extra pyramidal symptom. So which medicine I can use? Which medicine I can use? Which medicine I can use for this patient who has got extra pyramidal symptom? Answer is benzexole. So benzexole is a medicine that we can use. Vibhu, actually क्या है कि I mean latanoprost we are using in the form of eye drop. I am not giving it by systemic route. Like carboprost is a drug which is also a prostaglandin F2 alpha analog. This we give by IV route. So when I give prostaglandin by IV route, this will cause bronchospasm. This will cause bronchospasm. But here I am giving the latanoprost in the form of eye drop. So in eye drop form, studies have not shown that latanoprost can cause significant bronchial asthma. One more reason, guys, in this MCQ, there is no other possible answer. In this question, there is no other possible answer. So that's why we have gone for latanoprost, right? So question number 1, here the best answer is latanoprost only. So question number 4, here the answer is benzexole. So benzexole is a drug which is an anticholinergic medicine, centrally acting anticholinergic. This is given for the treatment of EPS. So answer is benzexole. Now we can, for a CKD patient, undergoing pyeloplasty, which is the best painkiller. So guys, for the CKD patient, we give the painkillers like opioids. So opioids and the paracetamol are the best painkillers. And for the liver disease patient, we prefer to use NSAIDs. So for liver disease patients, best painkillers are NSAIDs. For CKD patients, best painkillers are opioids and the paracetamol. So in this patient, who is a case of uh, patients who are like this patient is a case of CKD. So they are asking which painkiller is the best painkiller. Answer is acetaminophen. Paracetamol is the best painkiller in CKD. Right? So opioids and paracetamol are safe in CKD. NSAIDs are safe in liver disease. Question number 6. Patient is in end stage kidney disease. So patient is in end stage kidney disease, not having the urine output. So even the urine output is not there. And patient has got peripheral edema. So which antihypertensive is safe? So guys, like whenever this question is asked to you, if the patient will have the hypertension with comorbidity. So here the patient is having the hypertension with comorbidity. Please remember in MCQ, if any drug is given to you which does not belong to a class of first line drug, like we have the 3 first line antihypertensives. One is known as AC inhibitor ARB. Second is known as calcium channel blocker, and the third is known as diuretics. And among diuretics, we can use two options. We can use the Lasix, that is a furosemide, or we can use the chlorthalidone or the thiazides. So in diuretics, we can use loop diuretics and thiazides, calcium channel blocker, ACE inhibitor, ARB as a first line drug. So whenever question is asked to you on a treatment of hypertension with some comorbidity, so first of all, rule out the drugs which are not the first line drugs. So here two medicines are directly ruled out. Because they are not the first line antihypertensive drugs. Now guys, please remember in patients of kidney disease with no urine output, now thiazides efficiency will be almost zero. Thiazides efficiency will almost be zero because the thiazides required kidney for its action. And in this case, the kidney is non-functional. The kidney nephrons are not there. So how the thiazides will be useful in treating the edema? How will the thiazides will be useful in treating the hypertension? So calcium channel blocker, amlodipine, these medicines are metabolized by the liver. So they're asking which drug is safe. So answer is this medicine is safe. This is metabolized by the liver. So it is safe to use in patients of CKD. So here you will mark the best medicine as amlodipine. right? So in this way, you have to approach the question where they have asked you hypertension with comorbidity. So in hypertension with comorbidity, first of all, rule out the medicines which are not first line drugs. Then accordingly, you choose the answer which is most suitable according to the first line medicines. Like Mukesh Singh, metolazone is a thiazide that is only be used in patients of congestive heart failure. Now you can see Mukesh Kumar, here the patient is not having the CHF. So in case here the metolazone is also given. Here even the metolazone is also given. I will not go for metolazone as a thiazide because here the patient is not having CHF. Metolazone is given only for CHF. If here the patient is case of hypertension, you have to choose among the antihypertensive drug. Question number 7. Now this is a fact-based question. Patient has got a joint cell arthritis, having some polymyalgia rheumatica, mononeuritis monocomplex. I mean, multi-complex. Now, what should be the first line treatment? So, guys, they are again and again they are asking, Dr. Saloni, we have chosen the calcium channel blocker. You can see amlodipine is calcium channel blocker. That's why we have chosen calcium channel blocker. They are metabolized by the liver. So question number 7, this is a giant cell arthritis. Drug of choice is steroids. So steroids are mostly drug of choice for most of the autoimmune disorders, connective tissue disorders, right? So answer is prednisolone. Now guys, tocilizumab is a medicine which is interleukin 6 inhibitor. This is an interleukin 6 inhibitor. We can also try these medicines, but the better to use prednisolone as a drug of choice. Okay. Now, okay, next question is based on tocilizumab. But tocilizumab is interleukin 6 inhibitor. We can use this medicine. We can use this medicine. Guys, give me 1 minute. Okay. Yes, we can use this medicine for rheumatoid arthritis, and we have one more drug, sarilumab. So sarilumab is one more drug. Sarilumab is one more drug that we can give as an interleukin 6 inhibitor for rheumatoid arthritis. In the above question, Dr. Steth talks like if you ask me like which medicine is first medicine in the above question. So in the above question, guys, I would like to choose the first medicine as furosemide. I would like to choose first medicine as furosemide because of the presence of edema. Because of the presence of edema, I will choose first medicine as furosemide. The second medicine I will choose as AC inhibitor ARB. And the third medicine I will choose as calcium channel blocker. So this is a sequence of the medicines that I will choose in this MCQ for the treatment of CKD with edema. So guys, I have already given you the guidelines like how to choose the best medicine during our regular batch lecture. Like when the patient will have the hypertension with CKD, how to choose the best medicine. Like I told you, you have to consider few factors like proteinuria. Like here we don't have the proteinuria. That's why we will not give the answer as AC inhibitor ARB. So I've already given you this explanation during my regular batch lecture. So question number 9, patient with atrial fibrillation. The patient is on digoxin. Now you have started potassium chloride, trimethamine, clarithromycin, aspirin. The patient developed atrial fibrillation with controlled ventricular rate. So guys, patient has got atrial fibrillation, like the atria is contracting at very high rate, and patient has got ventricle is contracting at a low rate. So atrial contractions are high rate, ventricle is normal. So this is known as non-PSVT. So patient has got non-PSVT, and that is due to the digoxin toxicity. So non-PSVT, when the atria will contract at high rate and atria will contract at high rate and the ventricle will contract at low rate. So this is digoxin toxicity, and you can see here the digoxin level is increased from 2.5 to 3.5. This should be guys nanogram. They have given the milligram, written the milligram, but it's nanogram. So level is increased. So this is possible because of the clarithromycin. So please remember, digoxin is eliminated by P-glycoprotein. So there is a presence of a P-glycoprotein pump in the body which can eliminate the digoxin. So clarithromycin by inhibiting the P-glycoprotein pump, This medicine can inhibit the digoxin elimination and can result in digoxin toxicity as a side effect. So question number 9, answer is D, Delhi. Now question number 10, patient is on anti-hypertensive drug. So anti-hypertensive drug is very important topic for NEET PG. The patient has come to you with pre-conceptual counseling. Now which drug you will avoid? So guys, in pregnancy, there are two group of medicines which are contraindicated. Any medicine that will act on RAS pathway, renin-angiotensin pathway drugs like AC inhibitor, ARB, or the medicines are like aldosterone receptor antagonist. So AC inhibitor, ARBs, aldosterone receptor antagonist, these medicines are contraindicated, plus all diuretics. So these two groups are strictly contraindicated. These two groups are strictly contraindicated, but there are some groups which are safe and other medicines can be given if the benefit is more than risk. Like methyl dopa here is safe, but atenolol is not proved to be safe, is only be given when the benefit will outweigh the risk. Otherwise, it is not given. Now, lisinopril is an AC inhibitor. This is purely contraindicated. This is purely contraindicated, and nifedipine is a calcium channel blocker which is safe. That's why in question number 10, you will mark the best answer as C. So best answer is C in this MCQ. Question number 11. What is the mechanism of action of methotrexate? So methotrexate is competitive inhibitor of DHFRase enzyme. But according to students, they have asked a different mechanism in the question, although they have written like this way. But they have asked, what is the mechanism of action of methotrexate in rheumatoid arthritis? So the mechanism is, one more mechanism is, this medicine can increase the level of adenosine. Medicine can increase the level of adenosine and can have the anti-inflammatory effect, can have the anti-inflammatory effect in the body. So by increasing the level of adenosine, this medicine can have anti-inflammatory effect, and by inhibiting this DHFRase, medicine has immunosuppressant property. So question number 11, the best answer is A, but according to students, the question which was asked in the exam was this. They asked the adenosine level, not the DHFRase level. Right? Dr. Stretch, I'm not able to understand your question. You're asking, sir, diuretics can still be with. I'm not understanding your question. What exactly you want to ask, Dr. Stretch talks? There is some typing mistake. Now, Indian medical practitioner, best way of prescription of alprazolam. So, guys, whenever we have to write a prescription, that should be written in a standard unit, standard international units, and it should be written in a simple English language that is understandable to everyone. Understandable to everyone. So here the answer is B. Tablet alprazolam 0.5 milligram daily at bedtime for 7 days. This is the best. Milligram mg is the best standardized unit in which we can write the dose in simple English so that the patient will understand. So question 12, answer is B, Bombay. Now question number 13, a female taking oral contraceptive, she acquired tuberculosis. Now after anti-tubercular therapy, physician advised the patient for the alternative contraception. Physicians said use the alternative contraception. Why? Why the physician has said so? Because in anti-tubercular drug, we have a drug rifampicin, and rifampicin is a drug which is a liver enzyme inducer. Rifampicin is a liver enzyme inducer, and because it's a liver enzyme inducer, this can induce the metabolism of OCP. This can induce the metabolism of OCP, and because of inducing the metabolism of OCP, physician knows this thing that it can lead to contraceptive failure. That's why advise her to change the contraceptive method. So guys, whenever the patient will have the problem with rifampicin, always change the second drug. Always change the second drug. Do not change the rifampicin. Do not change the rifampicin. Always change the second medicine. Like if the patient is taking ATT with antiretroviral therapy, so you will change antiretroviral therapy. The guidelines says you have to increase the dose of dolutegravir. So one of the first line medicine for uh, HIV patient is dolutegravir. So according to the recommendation, you will not change the rifampicin even with ART. You will change ART. So ART mein which drug is changed? Answer is dolutegravir. So always change the second medicine, right? No, Dr. Diya Goswami, decimals are the standard ways to write. Like this is available in a decimal form only. The drug is available in decimal form. We can write 0.5 milligram. Like what else we will write? We cannot write the half milligram. We write the 0.5. 0.5 mg is the best way of writing the prescription. Question number 14. Which of the following formula is used to calculate the maintenance dose? So guys, if the question is asked to you, what is the maintenance dose? What is the dosing rate? So maintenance dose, dosing rate, what is the rate of elimination? So this is same. This is clearance multiplied by the plasma concentration. This is clearance multiplied by the plasma concentration. If the question is asked to you, what is loading dose or what is the any dose, any other dose of the drug, this is given by volume of distribution and plasma concentration. Maintenance dose, dosing rate, rate of elimination is this, right? So here the answer is B, Bombay. Maintenance dose depends upon plasma clearance and the target plasma concentration. So target plasma concentration, drug clearance, answer is B, Bombay. So question 14, answer is B. Right? This is same as rate of elimination formula. Question number 15. Now the patient has got breathlessness, chest pain. Patient has got chest pain, breathlessness plus irregular heartbeat. The patient has got mitral stenosis. So this patient suffers from atrial fibrillation with mitral stenosis. So patient is suffering from atrial fibrillation with mitral stenosis. Now they are asking which anticoagulant you will give. So which anticoagulant we can use. So guys, please remember, whenever the heart valve is involved, whenever the involvement of heart valve is there, we always mark warfarin. And whenever the cardiac valve is not involved, we always mark the medicines which are known as directly acting oral anticoagulants. So whenever the cardiac valve is involved, we will mark warfarin. And whenever the valve of the heart is not involved, we will mark directly acting oral anticoagulant. So here in this MCQ, we will mark the warfarin because the heart valve is involved. Now, if this question is based only on atrial fibrillation, like in this MCQ, if the mitral stenosis is not given, patient is only a case of atrial fibrillation, then I would have marked the dabigatran will be the best answer. So in that case, dabigatran would be marked as a best answer. But here in this case, I will mark the warfarin because when the valve is involved, the warfarin is the best answer. Warfarin has the best results in the conditions where the valve is involved, and the directly acting medicines have the less efficacy in cases where the valve is involved. Right? So here you will mark the best answer as warfarin. If the valve history is not there, you will mark the dabigatran. So question number 15, answer is A. Question number 16, the female is taken some, female is diagnosed with hypertension and she was started on therapy 2 weeks ago. Now she has got this condition. Now this is known as angioedema. Now this is known as angioedema. So angioedema is a side effect of ACE inhibitor. Angioedema is a side effect of ACE inhibitor. Now this is also a side effect of the medicine sacubitril, which is a part of a medicine, we call it ARNI. So angioedema is a side effect of ACE inhibitor as well as a medicine known as sacubitril. Sacubitril is a part of the drug that is ARNI. In ARNI, we have a second medicine that is valsartan. We have a second medicine that is valsartan. So sacubitril plus valsartan combination can cause angioedema. ACE inhibitor can cause angioedema. So here the answer is A. So she has taken lisinopril as a drug that has caused angioedema as a side effect. So question 16, answer is lisinopril. Now question number 17, a pregnant female was taking indomethacin. So she is taking one NSAID. Indomethacin is an NSAID which is a prostaglandin inhibitor. She is taking three times in a day for polyhydramnios. Right guys? So guys, try to understand. NSAIDs are the medicines which are inhibitor of prostaglandin E2 in kidney. Once they inhibit prostaglandin E2 in kidney, this will cause vasoconstriction. This will cause vasoconstriction in the kidney. Now, because of the vasoconstriction in kidney, the kidney blood flow is reduced, and therefore, when the kidney blood flow is reduced, the GFR will reduce. So, guys, if the mother is having polyhydramnios, you want that baby should not pass urine in fetus should not pass, not the baby, the fetus should not pass urine in the womb. You can give indomethacin for that, but this medicine should be given below less than 23 weeks of pregnancy. So less than 23 weeks of pregnancy, guys, there is a ductus arteriosus. Ductus arteriosus that is not developed. So ductus arteriosus not developed before 23 weeks. So NSAIDs can be given before 23 weeks, but after 23 weeks, if you give indomethacin, like she is 35 weeks. Now here there is a problem of premature closure. Here there is a risk of premature closure of ductus arteriosus. Now guys, if they will ask you, the baby is born with patent ductus arteriosus. So which regimen we use for closure? Like in case the baby is born with patent ductus arteriosus, we will give the combination of paracetamol plus the NSAID. Now NSAID is ibuprofen we can use. I can also use the indomethacin. So indomethacin and NSAIDs are the medicines which are NSAIDs that we use for closure. Now if I want to keep the ductus arteriosus patent, I will use the L-prostadil. So I will use the L-prostadil as a drug for this, right? So L-prostadil we can use as one of the drug to keep the ductus arteriosus patent. So question 17, answer is B. Now question number 18, patient with ECG changes with MI underwent open heart surgery. Now patient is taking lisinopril, verapamil, metoprolol. Now which is added in the list? Now this patient is having the MI. The MI means the patient will have the arterial thrombi. Now guys, for arterial thrombi, we give antiplatelets. And for venous thrombi, we give anticoagulant. So here in this patient, we need to add antiplatelet medicine. And which is an antiplatelet drug? P2Y12 inhibitor. So here we will add P2Y12 inhibitor. The medicine name is clopidogrel. So I can give clopidogrel to this patient, right, for the maintenance treatment. So clopidogrel can be given. But if this patient is undergoing surgery and during surgery they want some medicine, then there is a 1P2Y12 inhibitor. The drug name is cangrelor that can be given by parental route. So here the answer is C, P2Y12 inhibitor. So question number 19. Women regularly use aspirin. Now aspirin is also used as an antiplatelet drug. So this is also an antiplatelet medicine, most commonly used antiplatelet, right? So she used this medicine as a painkiller. The other use of aspirin is painkiller. One is antiplatelet. Now she developed the bleeding because the drug is antiplatelet. So this is due to the inhibition of thromboxane. So this medicine is inhibitor of COX-1 enzyme. So this medicine, by inhibiting the COX-1 enzyme, inhibit the thromboxane A2 synthesis. So by inhibiting the thromboxane A2 synthesis, right? So this medicine can lead to bleeding. The female has developed the bleeding. The side effect, answer is A. Now question number 20. A patient received halothane and developed the increased body temperature, hyperthermia and muscle rigidity. So guys, this is a anesthesia question. I don't know why it has come to the pharma. Now which medicine can increase the risk of this condition? So this is malignant hyperthermia. So patient has got malignant hyperthermia caused by this medicine, halothane. Now, which medicine can cause malignant hyperthermia? Answer is succinylcholine. So, succinylcholine is a drug which will also cause malignant hyperthermia. This is an anesthesia question, will be discussed in detail by your anesthesia faculty, right? So, malignant hyperthermia is further increased by adding succinylcholine. Dantrolene sodium is a drug of choice for this malignant hyperthermia. Now, question number 21. A girl on sulfonamides developed abdominal pain and presented in emergency with seizures. Now, this is symptoms of porphyria. So, in porphyria patients, we do not give sulfonamides, we do not give barbiturates. So, for your examination point of view, you have to just remember the names of two group of medicines which are avoided in porphyria patients, right? So, sulfonamides and barbiturates are two group of medicines which can precipitate symptoms of porphyria. So for your examination point of view, these two medicines names are important which can cause porphyria. So answer is A. Now let's move on to next question. Which year? 2020. So 2020 NEET PG exam. A patient on lithium therapy. Developed hypertension. Guys, have you noticed one thing? We are discussing the NEET questions and you hardly have any question from CNS. And once we prepare for INSCT, the questions are full of CNS only. So be careful. in NEET exam, you have to spend less time on CNS. You have to spend more time on the other topics. The CNS is more asked in detail in INSCT, less it is asked superficially in NEET PG. Like this question is from CNS now. So lithium therapy, patient on lithium therapy has got hypertension. Now you have given thiazides for the hypertension. The patient has developed coarse tremors and other symptoms suggestive of lithium toxicity. What is the interaction? So guys, body cannot differentiate between lithium and sodium. And because body cannot differentiate between lithium and sodium, thiazides are the medicines which can cause hyponatremia. So in absence of sodium, when the thiazides will cause hyponatremia, the kidney will start retaining more sodium. And when the kidney will start retaining more sodium, instead of sodium, in kidney at that time the lithium is also available and body cannot differentiate between two. So kidney will retain lithium. So thiazides can increase the tubular reabsorption of lithium because the body cannot differentiate between lithium and sodium. So question 1 answer is C. Question 2 is from General Pharma. They are asking which drug has highest potency. So which drug has highest potency out of all these four medicines A, B, C, D. So guys, potency is calculated on x-axis. So anything which is on the left side, any DRC which is on the left side, that is most potent, and anything that is on the right side is least potent, right? And the anything which has the highest, which has the maximum height, any drug which has the maximum height, that is most efficacious. So efficacy is height, you can see from this graph, and potency is the position on the x-axis. So here the A is on the extreme left. A, we can see it's on the extreme left. It is a most potent drug. But if the question is asked to you, which is the most efficacious medicine, then I will say the A and B. A and B almost have equal efficacy. So question 2 answer is A. Now question number 3, a patient, okay, a resistance to beta-lactam. So beta-lactams are the antibiotics. So resistant to beta-lactams is an alarming and the growing phenomena. Yes, everybody knows. It's a public health challenge. Yes, it's not a essay question. Why they are saying the essay type things. Now therefore, out of the following, what is the main mechanism of beta-lactam resistance with beta-lactamase enzyme? So beta-lactamase is an enzyme which is produced by bacteria to open the beta-lactam ring. So they will break the beta-lactam ring, and once this beta-lactamase will break the beta-lactam ring, then bacteria will become resistant, right? Now, the second is the most common method. They develop beta-lactamase and they can open the beta-lactam ring. Now, once the bacteria will change the medicine target, it's the second most common method. It's the second most common method of resistance. And when the Staph aureus will change the beta-lactam target, we call it MRSA. So we call it MRSA. So MRSA is a bacteria, is methicillin resistant Staph aureus, in which penicillin binding protein is modified. Right? Next is, now we have the pegluticase. Now pegluticase is a medicine which is a recombinant uricase. So this is a recombinant uricase. One more medicine is resp uricase. One more medicine belong to this class is resp uricase. So we have a pegluticase, resp uricase. Now where do we use this medicine? So we can use this medicine for the treatment of chronic tophaceous gout. Right? So this medicine is given for chronic tophaceous gout, and resp uricase is also given for the treatment of tumor lysis syndrome. Right? It is also given for tumor lysis syndrome. Now, when we use this medicine for chronic tophaceous gout, these medicines are given by subcutaneous route, and these medicines are always given. These medicines are always given with immunosuppressant medicines. Otherwise, they can lead to inflammatory phenomena. So these medicines are always given with immunosuppressant drug. Otherwise, there is a risk of inflammation or the inflammatory phenomena. And guys, these medicines are strictly contraindicated in J6PD deficiency patients. These respiricase and pegluticase strictly contraindicated in G6PD deficiency patients. So in G6PD deficiency patients, you have to remember two important medicines. One is primaquine. So primaquine is contraindicated. Second is quinine, like anti-malarials. So primaquine, quinine, these medicines are contraindicated in G6PD deficiency patient, plus the medicines which are artificial uricase. So artificial uricase and the antimalarials like primaquine, quinine, these medicines are contraindicated in patients of G6PD deficiency. So question 4 answer is P gluticase. C is the answer. Question number 5, which is not a prokinetic medicine. So guys, please remember 5-HT4 agonist, like the medicine name is cisapride, mosapride. They are the prokinetic medicine. Dopamine blocker, like the medicine name is metoclopramide, domperidone. So metoclopramide, domperidone, they are prokinetics. Macrolides will act on motilin receptor. Macrolides will act on motilin receptor. They are also the medicines which are prokinetic. So here doxazocin, which is an alpha 1 blocker, this is not a prokinetic medicine. So doxazocin is not used as a prokinetic, although doxazocin can result in diarrhea as a side effect, but it is not an it's not a prokinetic medicine. Dr. Krishna Priya, these medicines are given with methotrexate. Like if you ask me which is the most common immunosuppressant along with them, that is given along with this medicine, that is methotrexate. So guys, be careful. The urate lowering drugs, the medicines that will reduce the level of uric acid, they can initiate a fresh inflammatory response. So this is one of the important problem that is associated, especially with these medicines that is there. So for other medicines, like if you ask me, sir, along with allopurinol, which medicine we will give? So answer is we will give colchicine. So along with allopurinol, we give colchicine as a prophylactic drug of choice for inflammation. But here, along with these high special medicines, we will give immunosuppressants like methotrexate. Now, question number 6. A patient developed pain and insect crawling like sensation on legs at night time, and which is relieved by shaking her legs. So, guys, they want to give you a history of restless leg syndrome. They're asking what is the drug of choice. So, guys, in cases of RLS, restless leg syndrome, first of all, we will check whether the patient suffer from anemia or not. So if the patient will have the serum ferritin deficiency, you will mark the iron as the best medicine. You will mark the iron tablets as the best medicine if the serum ferritin level given is low. But here in this case, guys, there is no history of such kind of anemia given. So I will not mark iron tablets. Now, after that, for all patients, we prefer to give pregabalin. So pregabalin, gabapentin will be the drug of choice in this condition. If the iron stores are normal, we will mark pregabalin, gabapentin as a best medicines. Now, these medicines which are pregabalin, gabapentin, they have three problems. These medicines can cause lot of sedation. These medicines can cause weight gain. And these medicines have a problem of little bit of addiction. Now, if these three problems are there, like patient is involved in some important work, constant attention is required, patient is obese, or the risk of drug addiction is there, then you will mark the drug of choice as dopamine 2 receptor agonist like pramipexole. So pramipexole will be the answer in three conditions: when the patient required constant attention, patient is obese, and there is a risk of drug addiction, you will mark the pramipexole. Otherwise, you will mark the pregabalin, gabapentin. So question number 6, answer is B, Bombay. Question number 7, fluoroquinolone, that is contraindicated. Contraindicated in liver disease. So here the answer is pefloxacin. So pefloxacin is a medicine which is contraindicated in liver disease. So guys, please remember we have two fluoroquinolones which are exclusively metabolized by the liver. That is moxifloxacin. Second is pefloxacin. So these two fluoroquinolones are metabolized by the liver. So in patients of liver disease, we should avoid these medicines. Now guys, lomfloxacin is withdrawn many years back. This is withdrawn many years back because of liver toxicity as a side effect. So this is withdrawn because of liver toxicity as a side effect. Now guys, do you know when this was withdrawn? This was withdrawn when you people were not born. So when you people were not born, this medicine was withdrawn, lomfloxacin. So considering the fact lomfloxacin is an old medicine withdrawn many years back, here the medicine that is practically useful is pefloxacin. That's why you will mark the best answer as P. Sorry, the best answer will mark as a B, not the D. Right? So two medicines that is currently used that are metabolized by the liver, moxifloxacin, tefloxacin. So these here the answer is B, Bombay, right? Now question number 8. At high altitude, of 3000 meter, patient complains of breathlessness. All of the following can be used for the management of this person except. So guys, in this patient who is having the high altitude sickness, so patient can have the high altitude sickness or acute mountain sickness. High altitude sickness, acute mountain sickness, there is no role of digoxin. So digoxin is meant for heart failure. It has a no role in treatment of high altitude sickness. Now acetazolamide is the best medicine for prevention. Acetazolamide is the best medicine for prevention. Right? It's a drug of choice for prevention of high altitude sickness. It's a drug of choice for prevention, but sometimes at high altitude sickness, patient will get a complication. The complication can be high altitude pulmonary edema, high altitude cerebral edema. Now for high altitude pulmonary edema, when the patient has got a complication, now acetazolamide has no role. So here we will mark the best medicine as nifedipine. Here we can mark the best medicine as nifedipine, and for cerebral edema, we will mark the best medicine as dexamethasone. So high altitude cerebral edema, we will mark dexamethasone. For pulmonary edema, nifedipine. So if the question I'm marking here answer as A, I'm doubtful whether actually it was a digoxin given in the question or not. Maybe the question they have given the dexamethasone. Maybe they have given the dexamethasone in the question. So guys, in case option A is dexamethasone, right? Then the answer would be acetazolamide. In अगर MCQ में option A में dexamethasone है because cerebral edema is a acute emergency. In that case, you will mark acetazolamide as a best answer because acetazolamide has no role in the treatment. Patient has got a complication already, so acetazolamide will be the answer in case dexamethasone is given as a first option. Yes, Dr. Manoj Bishnoi, नमस्ते, कैसे हैं आप? Question number 9. Shibu, one of the reason for cerebral edema is inflammation caused by hypoxia and the altitude sickness. So dexamethasone is given as an anti-inflammatory drug that is given to reduce this inflammatory edema that is taking place in cerebral edema. That's why we give dexamethasone. ICT different होता है, cerebral edema is different, right? So you cannot confuse with ICT and cerebral edema. Although in cerebral edema and more CSF, we have the raised intracranial tension, but I mean, you cannot correlate these two things. Now, this point we have discussed already. Theophylline can cause diuresis because of adenosine A1 receptor antagonism. So, answer is B. You can see the questions now started repeating. Question number 10. Patient is a case of diabetes with COPD. Patient has got post-operative retention of urine. Patient has got a post-operative retention of urine. So guys, what is the drug of choice for post-operative retention of urine? So answer is bethanechol. So bethanechol is the medicine which is a drug of choice for post-operative retention of urine. But this medicine can cause bronchospasm as a side effect. So because of bronchospasm as a side effect, this medicine should not be given to a patient of bronchial asthma and COPD. So this medicine should not be given to a patient of bronchial asthma and COPD, right? So if we cannot give bethanechol, I have to move on to the alternative drugs. Now what is the alternative drugs? The alternative drug here is alpha-1 blocker. So guys, please remember, we have parasympathetic drugs. Parasympathetic drugs are known as cholinergic drugs and the anticholinergic drugs, right? And we have the sympathetic drugs, which are known as adrenergic drugs and anti-adrenergic drugs. So these are the 4 types of medicines that we discuss in autonomic system: cholinergic, anticholinergic, adrenergic, and anti-adrenergic. So guys, please remember the indications of cholinergic and anti-adrenergics are same. So they have the same indications, and the indications of anticholinergic and adrenergic are same. So here I am saying the bethanechol. Bethanechol ends with the word chol. So it's a cholinergic drug. This medicine is a cholinergic drug. Here I cannot give bethanical because of bronchospasm, so I will move on to antiadrenergic. Now, which drug is antiadrenergic? There are two medicines which are given here as an antiadrenergic: alpha 1 blocker, terazosin, tamsulosin. Now, guys, be careful. Terazosin is a drug which is alpha blocker, and by blocking alpha receptor, this will block alpha 1A as well as alpha 1B. Now, by blocking alpha 1B, this medicine can cause orthostatic hypotension. This medicine has a risk of orthostatic hypotension. But tamsulosin is a selective alpha 1A blocker. Tamsulosin is selective alpha 1A blocker. This will not cause orthostatic hypotension. Now, assuming the patient is diabetic patient, now this patient who is diabetic patient, he is having the autonomic neuropathy. Now, because of the autonomic neuropathy, there is a high risk of orthostatic hypotension. So this patient is at high risk of orthostatic hypotension due to its autonomic neuropathy because the patient is diabetic. That's why in this MCQ, considering the patient health state, I will choose the medicine tamsulosin as a best medicine. So tamsulosin is chosen as the best medicine here. The reason we have discussed in detail. So question 10 answer is D. Delhi. Tamsulosin is the best answer to be chosen. Now question number 11. They are asking what is a drug of choice for invasive aspergillosis? Answer is voriconazole. So voriconazole is a drug of choice for invasive aspergillosis. Apart from that, voriconazole is also given for the treatment of candida infection. Voriconazole can be given for the treatment of dermatophyte infection, right? And this medicine can be given to a patient of febrile neutropenia. So it can be given for the patients of febrile neutropenia. Here the drug given is liposomal amphotericin B. Liposomal amphotericin B, drug of choice for mucormycosis. And this medicine is also drug of choice for cryptococcal meningitis. This is a drug of choice for cryptococcal meningitis and mucormycosis. Caspofungin is an echinocandid. This medicine is echinocandid and it is a cell wall inhibitor. So this group of medicines are cell wall inhibitors. We call them uh, echinocandids, right? So question number 11, answer is voriconazole, drug of choice for invasive aspergillosis. Now, where do we use posaconazole? So guys, we have two azoles medicines. One is posaconazole, second is isavuconazole. So isavuconazole, posaconazole are the two medicines. These medicines are discovered or these medicines are mainly given for mucormycosis along with liposomal amphotericin B. So posaconazole and isavuconazole are the medicines which are given for mucormycosis along with liposomal amphotericin B. Right? So question number 11, answer is B. Question number 12, which of the following antihypertensive drug is avoided with high level of uric acid? So guys, this is again a simple question. You can see this is a fourth question we are attempting based on antihypertensive drugs. So can you see like how important this topic is, antihypertensive drugs? So which antihypertensive can cause hyperuricemia? Answer is diuretics. So diuretics can cause hyperuricemia as a side effect. So if the now let's discuss this question: hypertension with gout or hypertension with high uric acid. Now again, I already taught you how to choose the best medicine. So like I will say, okay, guys, choose the best medicine for this patient. Hypertension with gout. So the moment you will see the question, you will find that prazosin is ruled out. Why prazosin is ruled out? Because it's not a first line drug. So prazosin is straight away ruled out. It's not a first line drug. Atenolol is ruled out because it's not a first line drug. So these medicines are straight away ruled out. And hydrochlorothiazide I will not prefer because this medicine can cause hyperuricemia. So what will be the drug of choice in hypertension with gout? You will mark here the AC inhibitor ARP. So I told you in one of the previous question, whenever you have to choose the best medicine, always choose from the first line drug. So here we will choose losartan as a best medicine because that will cause uricose-uric effect. Second will be the calcium channel blocker and the third will be the diuretics here in this case. So in this way guys, we have to choose the best medicine first, second and third always from the first line medicines. So question 12 answer is A. Question 13, which of the following antimicrobial should not be given to a chronic asthmatic patient managed on theophylline therapy? So guys, please remember erythromycin. Erythromycin is a liver enzyme inhibitor. So should be knowing the names of medicines which are liver enzyme inhibitor. So by inhibiting liver enzyme, this medicine can inhibit the theophylline metabolism. So by inhibiting theophylline metabolism, this medicine can result in theophylline toxicity. So guys, this is the fourth question, I think. Third year, fourth question we are doing on the theophylline. So have you seen how important the theophylline and the bronchial asthma is? So bronchial asthma drugs, theophylline, very important topic. So question 13, answer is A. Now question number 14, a patient was given a muscle relaxant that competitively blocks the nicotine receptor. Yes, so muscle relaxants are blocker of nicotine M receptor. Which drug is used for the reversal? So which medicine we can use for the reversal? So answer is neostigmine. So neostigmine and glycopyrrolate, they are given together. So neostigmine plus glycopyrrolate combination we use as a best combination. This is given as a best combination for the reversal of the effect of skeletal muscle relaxants like the curiums and the curare. So patients will have the word medicines have the word curium and curare in their name. So neostigmine is the best antidote. It is always given with glycopyrrolate. Actually, glycopyrrolate is not given again. It is given as one of the pre-anesthetic drug. So when we give glycopyrrolate as one of the pre-anesthetic drug, this is already there in the patient body. This is already there in the patient body. So at the end of the surgery, we need not to repeat the medicine. So we need not to repeat the medicine again at the end of the surgery because the drug we have already given pre-anesthetically. So now you have to give only neostigmine. But if you ask me theoretically, sir, what is the best regimen? The best regimen is going to be neostigmine plus the glycopyrrolate. So question 14, answer is A. Question number 15, anti-glaucoma drug that acts by increasing uveoscleral outflow. So guys, this is latanoprost. Latanoprost is a drug of choice for glaucoma. And guys, from here I would say we are doing, I think we are doing the 7th or 8th question on anti-glaucoma drug. You can see how important the anti-glaucoma drugs are. So medicines which can increase uveoscleral outflow, the drug is latanoprost, right? So very important topic, that is uh, glaucoma drugs. So you can see it's the 7th and 8th question we are doing. So question 15, answer is rapid revision session. We people already have the rapid revision sessions in the app. So in app we have this session for the NEET PG rapid revision session where we people have, I mean, we have recorded this pharma lectures in 16 hours. In 16 hours we have uh, given you the whole summary of pharma, and also we have a 6 hours of one short revisions, one short session of 6 hours. So as per your convenience, guys, you can watch that rapid revision. You can also go for that 6 hours of one shot. So one shot is only for the, I mean, just for the refreshing, the drug of choice for everything, right? And for rapid revision, you will have the whole summary of pharma in 16 hours. Question number 16. The patient diagnosed with rheumatoid arthritis and he was on medication, and after 2 hours he developed blurring of vision and found to have corneal opacity. So which drug is best medicine? Which drug can cause this problem? Answer is chloroquine. So we people, okay, in previous question, why not pilocarpine? A pilocarpine will increase trabecular outflow. So Dr. Pooja, Dr. Poo, this will increase the trabecular outflow. And they're particularly saying which medicine can increase uveoscleral outflow, right? So both medicines can increase the outflow, but pilocarpine will increase trabecular and latanoprost will increase uveoscleral. Now you people have to answer me which other medicine you know that start with word N, and that medicine can also increase trabecular outflow. That medicine can also increase trabecular outflow. The start with N. Till that time, I'll solve this question. Now, guys, this chloroquine is a drug that is used in the form of HCQS, hydroxychloroquine sulfate, and this medicine can cause bullseye retinopathy. This medicine can result in bullseye retinopathy as a manifestation. That's why the patient vision has gone down. Plus, this medicine also get deposited in cornea. This medicine also get deposit in the cornea. So this is the problem that is seen with HCQS. So HCQS can lead to the side effect. that is bullseye retinopathy, and can lead to corneal deposit. Yes, Dr. Supriya has given the correct answer. Yes, now other students also have given the correct answer. Dr. Nimra, Dr. Nitesh, Rajat, Bhomik, Mubashira, Altaf, Saloni, Sildenafil, Shruti Sunil, all of you have given the correct answer. The drug is nitarsudil. So nitarsudil is one more drug that will increase the trabecular outflow. Yes, it's a Rho kinase inhibitor. So question number 16, HCQS is the answer. Second question we have done on the rheumatoid arthritis. Question number 17, a patient is traveling by a bus and patient is used to get the motion sickness. Now which medicine we can give? So guys, drug of choice for motion sickness is hyoscine. So everybody knows drug of choice for motion sickness is hyoscine, which is also known as popolamine. And this medicine can be given in the form of skin patch. Medicine can be given in the form of skin patch, but that is not available. That is not available in India. So in India, we give promethazine. So promethazine is a medicine. Promethazine is a medicine that is Promethazine is a medicine that is given in India, not the hyoscine skin patch. Dr. Vasant Philip, I am doing the FMG one shot on the 7th of this month. 7th of June, I am doing this FMG one shot, and I would be taking guys around 30 most important topics, and I bet you like if you attend those 30 topics, the questions will come from those only, right? So for FMG, we'll be doing this session of one shot on 7th of this month, right? And the dates will be updated. Like in case there is a change in the date, we'll update you. So question number 17, answer is A, promethazine. Now question number 18. Question number 18. Guys, one thing I would like to say here. Have you noticed it's a fourth question based on anti-emetic drug? Like they ask you metoclopramide can cause muscle dystonia, right? And they also have asked you this motion sickness. They also asked you about the chemotherapy induced nausea vomiting, right? So these are the things which are important. You have to concentrate for the NEET exam, like the antiemetics, like the anti-hypertensive drugs, right? So these topics are important. Anti-glaucoma drugs we have discussed. So question number 18. Question number 18, we can see which of the following anti-arrhythmic drug contraindicated in interstitial lung disease, amiodarone. So second time they have asked the same question that amiodarone can cause pulmonary fibrosis. Quinidine starts with Q. This will cause QT prolongation. This is important guys for this year exam. My gut feeling they will ask you. Uh, they will ask you this lignocaine toxicity. So this year they will ask you lignocaine toxicity. So please remember, lignocaine toxicity will cause uh, they will cause, whenever patient will have lignocaine toxicity, patient will have the CNS toxicity. When CNS toxicity, patient first of all have the CNS excitation. Patient first of all have the CNS excitation, where the patient will have the tremors followed by the seizures. Patient will have the tremors followed by the seizure. And if you will not reduce the medicine, the patient will have the CNS depression. Patient will have the CNS depression, where all the CNS centers will go down. All the CNS centers will go down, and that will lead to collapse of respiration and the BP. So BP and the respiration will be collapsed. So CNS centers will be suppressed. So this question is going to be asked guys this year. This is my gut feeling. This not been asked. It's not 100% confirmation. So lignocaine toxicity will cause post. This will cause post excitation depression. We call it post excitation depression. So lignocaine toxicity can result in post excitation depression. We are talking about CNS. CNS is first of all stimulated, then CNS is inhibited. So post excitation depression. Question 18, answer is A, amiodarone. Question 19, which is a late invert sodium channel blocker. So guys, please remember the answer is denolazine. And we people have discussed so many mnemonics during our lecture, and we people made this mnemonic. Lazy people are always late. Lazy people are always late. Here we made a mnemonic. Lazy fox is late. So denolazine is inhibitor of the late sodium current, as well as this medicine is inhibitor of partial fatty acid oxidation. This is also inhibitor of partial fatty acid oxidation. So we people have made this mnemonic during our lecture. Lazy fox is always late. So lazy fox is always late. Ivabradine, we people made a mnemonic. I stands for funny channel, funny current. So this is inhibitor of the funny current and can result in bradycardia. Fasudil, we people made a Hindi mnemonic which is not applicable here. So it's a rho kinase inhibitor. Fasudil is rho kinase inhibitor, right? So question 19, answer is B, Bombay. Now let's move on to guys 2019. So 2019 PYQs for the NEET. So what is the drug of choice for diphtheria carrier? So this is a fact-based questions uh, asked from antimicrobials. So diphtheria carrier, diphtheria treatment of choice is same. So diphtheria carrier, diphtheria drug of choice, diphtheria treatment of choice, diphtheria prophylaxis is always same. It's erythromycin. So question number 1, answer is C. Erythromycin is the answer, right? Now, question is, which is the orally active direct factor 10A inhibitor? So any drug guys which has the word XA ban, any drug which has the word XA ban, that is going to ban the factor 10A. That medicine is going to ban the factor 10A. So this is rivaroxaban. And rivaroxaban should always be taken after food. Please remember, when this medicine is taken after food, its absorption is always better. Rivaroxaban absorption is always better when taken after food. This is something, the guidelines associated with rivaroxaban usage. Right, so guys, have you noticed it's a fourth question we are doing that is based on the anticoagulant or antiplatelets. So I'm telling you the important topics in between, like anticoagulants, antiplatelets, very important topic. Not the fourth question, I think sixth question we are doing. So in last 5 years, 6 times they have asked the topics like antiplatelets and anticoagulants. Now, mechanism of action of curare like drugs or curial like drugs. So guys, these medicines we have discussed already. They are the blocker of NM receptor, and neostigmine is given as an antidote. So they will block the acetylcholine receptor, that is NM receptor. So guys, have you noticed one thing? Medicines को कहते हैं cholinergic drugs. Cholinergic drugs are very very important topic for your exam. Like this is the first question. Previous question they have asked the antidote. In one of the previous question they asked the bithenecol. In one of the previous question they asked the botulinum toxin. So all these drugs which are related to the cholinergic system are very very important for your exam. So question number 3, answer is B, Bombay. Question number 4, they have asked which medicine is best medicine for SIADH. Now SIADH is a condition where the antidiuretic hormone activity is very high, and this will act on the vasopressin 2 receptor, and by acting on the vasopressin 2 receptor this can cause water retention. As a result of water retention, the sodium level will go down, and that is known as hyponatremia. So basically they want to ask which is the best medicine for hyponatremia. So the best medicine for hyponatremia is tolvaptan. So tolvaptan is a drug which is a vasopressin 2 receptor antagonist. It's a vasopressin 2 receptor antagonist. This is a drug of choice for SIADH, and one of the important side effects of this medicine is osmotic demyelination syndrome. One of the important side effect is osmotic demyelination syndrome. So answer here is A, that is tolvaptan. Now question number 5. Now see again the vomiting has come. So vomiting is something which is like very important topic in GIT. Like it's more important than your peptic ulcer disease. Like have you noticed that there is no question from proton pump inhibitor? There is no question from H2 receptor antagonist. They're asking chemotherapy drugs. They're asking the antiemetics. They're asking the prokinetic medicines, but they're not asking the proton pump inhibitor. So spend less time on these topics which are less commonly asked. So what is a drug of choice for chemotherapy induced vomiting? It's granisetron here. So the vomiting can be early, vomiting can be delayed or late. So vomiting that will start within 24 hours. We will give the medicines which end with the word citron. These medicines are 5-HT3 blocker. These medicines are 5-HT3 blocker. Now the late vomiting means the vomiting that will start after 24 hours. Here we give the medicines which end with the word patent. Medicines that end with the word patent. So these medicines which are patent, they are the blocker of neurokinin 1 receptor. They are the blocker of neurokinin 1 receptor. So patents are the medicines that we use for late vomiting, like aprepitant. One example is like aprepitant. And citrons are the medicines that we give for early vomiting. So question 5, answer is A. Now question number 6, which drug is potassium channel opener? Which drug is potassium channel opener? And that will be useful for angina. So guys, have you noticed? They have asked the mechanism of action of anti-anginal drug. So mechanism of action of anti-anginal drugs, the second question that we are doing. So be careful, like these kind of things are asked. This is same as ranolazine. Guys, do you remember? Lazy. So lazy fox is always late. It's a late sodium current blocker. Lignocaine, I told you, it's an anti-arrhythmic drug. Lignocaine is sodium channel blocker. It's an anti-arrhythmic drug. Can result in post-excitation depression of the CNS. Now guys, nicorandil. Nicorandil is a drug that ends with the word dil. So in Hindi, the dil means heart. So this medicine is electron heart. It's a CO. It's a channel opener. So this medicine is a channel opener. So nicorandil is a channel opener. It's a potassium channel opener given for the cardiac condition like angina. Now guys, this is the very important drug verapamil. Verapamil is also one of the very important drug. It's a calcium channel blocker. This medicine is a calcium channel blocker, can result in constipation as the most common side effect, and this medicine is contraindicated. Contraindicated in patients of heart failure. This medicine can reduce the cardiac output, so contraindicated in heart failure patients. And constipation is the most common side effect. It's a calcium channel blocker. So question 6, verapamil, you have to concentrate, and nicorandil is the answer of the question number 6. Question number 7, which drug is used to differentiate, diagnose or differentiation? Useful for differentiation of myasthenia gravis from cholinergic crisis. That is again the same question asked from cholinergic drugs. So you can see the drug name is edrophonium. Edrophonium action will drop at a very fast speed. It is one of the short acting medicine. It is one of the short acting medicines. So remember like this way, the action of the medicine drop at a very fast speed. Action of the medicine drop at a very fast speed. So this is a medicine that we use to, which we can use to differentiate between myasthenia gravis and the cholinergic crisis. So question number 7, again based on cholinergic drug. The 7th question we are doing on the cholinergic drug. Answer is B, Bombay, edrophonium. Question number 8, which of the following is alpha 2 agonist? Now guys, there's a question number 8 based on anti-glaucoma drugs. So anti-glaucoma drugs, you can see the 8th question they are asking in last 5 years. So which of the following drug is alpha 2 agonist? So which is then alpha 2 agonist? Alpha 2 agonist, the drug name here is epiraclonidine. So we have the medicines like epiraclonidine and brimonidine. So epiraclonidine, brimonidine, these medicines are alpha 2 agonist. They can stop the aqueous humor synthesis. They can stop the aqueous humor synthesis, and we can use them as an anti-glaucoma drug, right? And these medicines should not be given to small babies and neonates. Should not be given to neonates because these medicines can cause respiratory suppression. Medicines can cause respiratory suppression. Should not be given to neonates. This is a question which they can also ask. Question number 9. Now topic is antifungal drugs. So antifungal drug is the second question asked in last 5 years in NEET exam. Otherwise in INCT, antifungal is a hot favorite topic for the examiner. Now the medicines are azoles like ketoconazole, fluconazole, itraconazole. Now these medicines will inhibit one enzyme known as 14 alpha demethylase enzyme. So by inhibiting 14 alpha demethylase enzyme, they can stop the ergosterol synthesis. The ergosterol is something which is the raw material for the fungal cell membrane. It's a raw material for the fungal cell membrane. So by inhibiting 14 alpha demethylase enzyme, they can stop the raw material of the fungal cell membrane. So fungal cell membrane synthesis will not take place. So we can use azole as one of the antifungal drugs. Right? Now the medicines which are beta-1,3-glucan inhibitor. Now these medicines are echinocandidates. Now guys, please remember very important points. Echinocandidates are the medicines which are given by IV route, and they are useful for the treatment of candida. So they can be given for the treatment of any candida species. They are very good medicines for candida species. For all type of candida species, we can use the medicines like echinocandidates given by IV route, and these medicines can be given for aspergillosis. Can be given for aspergillosis, and among antifungal, this is the only group of medicines which can inhibit the cell wall. So echinocandidates, by inhibiting beta-1,3-glucan, They can inhibit the fungal cell wall. There is no other medicine which can inhibit the fungal cell wall. Only echinocandidates can inhibit. So question 9, answer is A. Question number 10, guys, colchicine, we people have discussed already. This medicine is an anti-inflammatory drug. I told you this is given for acute attack. This is given for acute attack because it's an anti-inflammatory medicine. Plus, this is also given with urate lowering drugs. They are also given with urate lowering drugs, also given in urate lowering medicines to prevent the inflammatory attack. We discussed that these medicines, this is given along with urate lowering drugs to prevent the inflammatory attack. And how this medicine will act? This medicine will act by inhibiting the WBC multiplication. So if WBC cannot multiply, the medicine can cause metaphase arrest, and medicine can also stop the WBC recruitment at the site of inflammation. So all of the above are correct here. So colchicine is a medicine that we can use for the treatment of gout. Question number 11. This is a fact-based question. So I don't think so this question will be repeated again. So the drug is teduglutide. Teduglutide is a GLP-2 analog. Oh, oops, they have made a mistake over here. So basically this is a GLP-2 analog. It's not a GLP-2 inhibitor. It's a GLP-2 analog, teduglutide. Now this medicine can increase the thickness of small intestine. Medicine can increase the thickness of small intestine, and by increasing the thickness of small intestine, that will lead to more absorption of the food. That will lead to more absorption of the food, which is disrupted in the short bowel syndrome. So in short bowel syndrome, because of the short length, the patient cannot absorb the food properly. So this medicine will help in food absorption. Drug name is teduglutide. Students, make the mnemonic like this way. Like Tedu, they remember like this way, Teddy. So Teddy is liked by the short human being, that is the pediatric patients, right? You can remember like this way. Tedu is given to short people, right? So Tedu or Teddy is given for short people. So question 11, answer is A. Question number 12. So what is the drug of choice for digitalis induced ventricular arrhythmia? Answer is lignocaine, right? So guys, what is the overall drug of choice for ventricular arrhythmia? So for ventricular arrhythmia, we prefer to give amiodarone. Second, we give lidocaine. Second, we give lidocaine. And for atrial fibrillation, atrial flutter. Atrial fibrillation, atrial flutter, amiodarone is again the drug of choice. But please remember, amiodarone is a drug which is a P-glycoprotein pump inhibitor. And by inhibiting P-glycoprotein pump, this medicine can reduce the digoxin elimination from the body and can result in digoxin toxicity. So this can result in digoxin toxicity. That's why in patients of digitalis induced ventricular arrhythmia, instead of choosing amiodarone as a best medicine, we choose lidocaine as a best medicine. So amiodarone, we should not give with digoxin because it can inhibit this P-glycoprotein pump and can lead to digoxin toxicity more. Now you can see here, guys, uh, Verapamil, again they have given the option. So Verapamil is important drug for the exam. Yes, you should be knowing the names of the medicines which are P-glycoprotein inhibitor. Mostly the medicines which are P-glycoprotein inhibitor, like one question we have done on the clarithromycin, but mostly this is asked in the AIMS exam. Like INSCT people are very, like they are the fond of asking this question, which are P-glycoprotein pump inhibitors, but I don't see these questions asked in your NEET exam. Question 13, fluoroquinolone. So guys, this is the second question, not second, rather third question, which is based on pharmacokinetics of fluoroquinolone. So pharmacokinetics of fluoroquinolone is important for the exam. Like previously they asked which drug should not be given in liver disease. Then they asked one more question regarding the moxifloxacin, right? Now the third question they are asking which medicines have maximum bioavailability. So guys, levofloxacin, ofloxacin. Levofloxacin, ofloxacin, they have almost more than 95% of oral bioavailability. They have almost more than 95% of the oral bioavailability. So according to the students, when this question was asked, both levofloxacin, ofloxacin were there in the MCQ. So both levofloxacin, ofloxacin were there in the MCQ. So you have to choose the best medicine. Levofloxacin is a better answer than the ofloxacin. So question 13, answer is C. Question 14, oseltamivir. Oseltamivir is a drug of choice for swine flu. So this is a medicine which is a drug of choice for swine flu and bird flu. Now how this medicine will act in the body? This is a neuraminidase enzyme inhibitor. So this medicine is neuraminidase enzyme inhibitor. It's a drug of choice for swine flu and bird flu. This is given by oral route, and this medicine is given in a dose of 75 milligram 2 times in a day, and it is given for 5 days. 75 milligram given 2 times in a day for 5 days. The drug name is oseltamivir. Question 14, answer is C. Yes, neuraminidase enzyme inhibitor. Question number 15. So guys, we have an anti-anxiety drug. So you can see psychiatry mein they have, this is a third question which we are attempting. So CNS, overall CNS is less commonly asked, although CNS is a very vast topic. But in NEET exam, CNS probability of asking the question is low. Or if they're asking the question, they're asking simple basic question. Like one of the question that we did was on lithium toxicity. Second question we did on the clozapine side effect like cialorrhea. The third is buspirone we are doing. So buspirone is a drug which is a 5-HT1A receptor agonist. This is serotonin 1A receptor agonist. This medicine we can use as a drug for anxiety. So this is a medicine that we use for generalized anxiety disorder. So this medicine is meant for generalized anxiety disorder. So question number 15, answer is A. Now, carbapinins are the medicines which can cause seizures as a side effect in CKD patient. So there are two beta-lactams which can cause seizures in CKD patients. So these medicines can cause seizures like cefepime and imipenem. So in CKD patient, imipenem and the cefepime are the medicines which can lead to seizures as a side effect. The fact-based question based on antimicrobial. Question 16, answer is A. Question number 17, like hematology again, how to manage bone marrow suppression. Like one question we did that was based on platelets, how to increase platelet count. Now filgrastim is given to increase the WBC count. Filgrastim is given to increase the WBC count, and darbepoetin we give to increase the RBC count. So darbepoetin for RBC, for WBC we give filgrastim, and previous question we did oprelvicin, that is for platelets. So question 17, answer B. Question number 18, this is a third question based on rheumatoid arthritis. One question we did that there they asked the methotrexate mechanism of action. Second question, guys, they asked the tocilizumab mechanism of action. Third question we are doing on the rheumatoid arthritis, where the patient is taking methotrexate, steroid, and NSAID. Patient has taken medicine for 4 months, still the disease is progressing. It means the patient is a case of refractory case. This patient is a methotrexate refractory patient. So patient is methotrexate refractory patient. What should be the next probable step? So guys, in these kind of patients who are methotrexate refractory, the best option is add TNF alpha blocker. The best option is add TNF alpha blocker. If it is not given to you, right, this is given by IV route. The second option is you can give methotrexate along with sulfasalazine and the HCQS. So along with sulfasalazine, HCQS, we can give the second combination. We call it triple regimen. 3 medicines are given together. If it is also not given, you can also give the interleukin 6 inhibitors. Like tocilizumab we can give. If it is also not given, the fourth best option is you can give the Janus kinase inhibitor. So here guys, none of the statements satisfy this. You can see here, they are saying start monotherapy with anti-TNF blocker. No, we always add. We don't start the monotherapy. Right? Now they are saying continue the methotrexate and steroid. No, there is no rationale because the treatment has already been failed. What is the definition of methotrexate refractory patient? So methotrexate refractory, the definition is when the patient is not responding to the treatment after 3 to 6 months. So the criteria of 3 months has already been passed. No rationale of continuing with the methotrexate and steroid only. We have to do something. Now the fourth option saying add sulfasalazine. Now this is incomplete statement. So as far as I know, students say, sir, here they also gave the option as HCQS. So if the option is HCQS along with this, then the answer is this. No doubt about that, because we are going for the second oral triple regimen. But guys, let me tell you, methotrexate is a medicine that is given by oral route. Methotrexate is a medicine that is most commonly given by oral route in patients with rheumatoid arthritis. But the best route for methotrexate, best bioavailability of methotrexate in rheumatoid arthritis is by subcutaneous route. Best route is subcutaneous route of the methotrexate. Although patient is not comfortable, but according to some clinical trials, According to some clinical trials, the patient who is not responding to oral methotrexate, if you don't have any other option to give, you can try. You can try to switch the route also. There is a possibility that more methotrexate will reach the plasma, and now you can have the better effect of methotrexate. So, according to me, the best answer of this question is C, considering the same option they have asked in the exam. But if we consider the D option, then the HCQS should have been added along with sulfasalazine. Otherwise, there is no regimen like where we give two drugs. There is no regimen where we give methotrexate plus sulfasalazine. It's always better to give the triple regimen. There's no guidelines to suggest to combine two drugs, like to give two medicines. Always give the three medicines. So question 18, answer is C, according to me, based on the fact that subcutaneous route has better bioavailability, and in case we don't have any other satisfying option, so we are going for the C option. Question 19, variation in sensitivity of response. Variation in the sensitivity of response to different doses of the drugs in different individuals obtained from. So guys, this is the DRC. So whenever you find the word response, this is dose response curve. So answer is A. The third question we are doing on the dose response curve. So guys, in general pharma, pharmacodynamics is a very important topic. So pharmacodynamics is a very important topic, especially the DRC is important aspect. So you should read this DRC. Question 19, answer is A. Now moving on to question number 20. So question number 20, what is the most probable reason for preference of cis atracurium over atracurium? So it's again a question of anesthesia. This will be discussed by your anesthesia faculty in detail. Basically what happens, this atracurium is the one that will form uh, a metabolite, that is lodanosine, and lodanosine can cause CNS toxicity as a side effect. Now cis atracurium will not form this type of metabolite. So this type of metabolite is not formed by the cis atracurium, right? So that's why we prefer cis atracurium over atracurium, because this will result in formation of a toxic metabolite. We call it lodanosine. So answer is, I mean, the D Delhi, increase CNS toxicity, right? Next is question number 21. Question number 21. Imipenem, like you can see guys, this is the fourth question we are doing on the beta-lactam antibiotics. So beta-lactam antibiotics, we discuss how the bacteria develop resistance. We also talk about the seizures as a side effect of imipenem. Third question, imipenem is a drug that is always given with cilastatin. So why this medicine is always given with cilastatin? Histamine तो guys दोनों release करेंगे ना. Atracurium, cis atracurium, they belong to same class. So they release histamine. So both can release histamine. Atracurium, cis atracurium, both can release histamine. The structure is same, right? So answer cannot be A. The reason is this. Like when the atracurium is metabolized in the body, this will form a metabolite. So this metabolite is toxic. That's why atracurium is outdated. Nobody use atracurium these days. Everybody use cis atracurium. Question number 21. So question number 21, cilastatin given with imipenem, because this can inhibit the enzyme that is that can metabolize the imipenem in the kidney. So cilastatin can inhibit that kidney enzyme and can prolong the action of imipenem. Can prolong the action of imipenem. No, Ritvik, this is not the reason. Na? Histamine is not the criteria. Criteria is written in front of you. Metabolite is the criteria. I mean, atracurium is 80% metabolized by Hoffman elimination, 20% by the liver. And because of that liver component, it will form a metabolite. Cis atracurium is only by the plasma, no metabolite. Question number 22. Let's wind up the topic, guys, because it's already been 2 hours. Since last 2 hours, we are doing the questions continuously. So what is the advantage of fixed dose combination? It's a general question, general GK question. FDC will increase the efficacy. Yes, if we combine the two drugs, this will increase the efficacy. They can decrease the adverse effect. Yes, one drug can antagonize the each other's adverse effect. Patient compliance is improved. Yes, patient is more comfortable. So answer is D Delhi. So question 22, answer is D Delhi. All of the above can be the answer, right? Question number 23. Now conversion of norepinephrine to epinephrine. So conversion of norepinephrine to epinephrine, it's a biochemistry question. It's a BC question. Why it has come to pharma, I don't know. So conversion of norepinephrine to epinephrine is done mainly by the dehydrogenase enzyme. It is mainly done by the dehydrogenase enzyme, right? So this is dehydrogenase enzyme. Question 23, answer is D. Now IV mannitol is a diuretic. So guys, indications of diuretics are very important. Where do we use diuretics? Indications of diuretics. This is, I think, third or fourth question we are doing. Indications of diuretics. So mannitol is given for glaucoma and for CHF patient, with pulmonary edema and the patients of end stage kidney disease. In patients of end stage kidney disease or patients of CHF with pulmonary edema, this is contraindicated. So it is given for acute congestive glaucoma. So indications of diuretics are important. Question number 26. A nursing female presented with fever and the breast tenderness. So she has got a skin infection. So she has got a skin infection of the breast. She has got a skin infection of the breast. So which oral antibiotic? Which oral antibiotic she will take? So guys, for the skin infection, we can give the beta-lactam antibiotics. For skin infection, if there is no pus, if there is no abscess in the skin infection, we can give the beta-lactam antibiotics like amoxiclav. Amoxiclav is one of the very good option. We can use the medicines like cloxacillin and dicloxacillin. We can use the medicines like cloxacillin and dicloxacillin. We can also use the generation 1 cephalosporin like the cephalexin. So these beta-lactams we can use in the treatment of skin infection if there is no pus, right? Ampicillin is a drug which can lead to diarrhea as a very important side effect because of its poor absorption, and that will go to the baby body. This will cause diarrhea. Ceftazidime is mainly given by IV route for Pseudomonas, and this baby or this mother is not having the Pseudomonas infection. Pseudomonas is infection that is mainly seen in hospital-acquired cases, hospital-acquired infection. It's not a case of hospital-acquired infection. And ciprofloxacin is avoided in breastfeeding because this can go to the baby body and can interfere with the cartilage as well as the tendon growth. So question 26, answer is B, Bombay. Question 27, what will happen if the medicine is highly plasma protein bound? So if the drug is highly plasma protein bound, then the size of the drug molecule will increase. And when the size of the drug molecule will increase, this medicine cannot go to any place. Medicine cannot go out of the plasma space. Medicine cannot go to any organ, right? And this medicine is not available for filtration. Medicine is also not available for filtration in kidney. So highly plasma protein binding, the medicine will not go anywhere. Medicine size of the molecule will increase. It will stay in the plasma. The drug will stay in the plasma for a long time. When the drug will stay in the plasma for a long time, the drug will not go anywhere. So the drug is not available for filtration also. So medicine is also not available for filtration. Question 27, answer is A. Question number 28. Hypertension with pulmonary edema associated with scorpion sting. So guys, in scorpion sting, first of all, we give anti-venom. After giving anti-venom, if the BP is still high, if the BP is still high. So after giving anti-venom, if the BP is still high, right, then we give prazosin. So give anti-venom, if the BP is still high, you will give prazosin. So here the answer is prazosin. So prazosin is the drug that is given in patients of scorpion sting. Now question number 29. A patient has got microscopic feature of oocyst. So patient has got oocyst. So cyst, patient is passing cyst with diarrhea. So this is the amoebic cyst which patient is passing. So patient is a carrier. Patient is a carrier. Patient is having the luminal amoebiasis. So this patient is having the luminal amoebiasis. And for luminal amoebiasis, where the patient is passing the cystic stage is a carrier stage, like it's a dormant stage. So here we have to give the medicine parmomycin. It's a luminal amoebiasis, right? So luminal amoebiasis, we have to give the medicine parmomycin. So parmomycin is a drug of choice. So parmomycin is the best medicine for luminal amoebiasis. If this patient is having the dysentery, if this patient is having the blood in the stool, It means the amoeba has invaded the intestine. It means the amoeba has invaded the intestine. So in that case, we will give metronidazole. So in that case, you will give metronidazole. Right? So question number 29, answer is A. You will give the medicine for luminal amoebiasis. You will choose the parabomycin because the cyst, oocyst means it's a carrier stage, it's a dormant stage, which is passed in the stool, and this is required for the spread of the infection. So 29, answer is A. Right? Now, guys, we have the 2018 questions. They have asked the 6-year questions or 5-year questions. Would you like to do this 2018 questions or shall I skip? Okay. Should I do this 2018 question? Okay, so let's finish it fast. So, antifungal amphotericin B. So, amphotericin B is a cell membrane inhibitor. This medicine is cell membrane inhibitor. So, most of the antifungals are, most of the antifungals are cell membrane inhibitor. Now, who will tell me which antifungal are cell wall inhibitor? So, I'll ask the question from you people now because we people have already covered. Who will tell me which antifungals are cell wall inhibitors? So all are cell membrane inhibitor. Who will tell me which antifungals are cell wall inhibitors? Okay, no one is answering. No problem. Now, alternative of epinephrine for pulseless arrest in ACLS, advanced cardiac support. Which drug is used? Answer is amiodarone. So amiodarone and lidocaine. Amiodarone and lidocaine are the two medicines that we use in patients of ACLS. Yes, echinocandidates is the answer. They are the cell wall inhibitors that we have covered. So amiodarone and lidocaine are the medicines that we can use in pulseless electrical activity in patients of cardiac arrest. Now, here you have to tell me what will happen in lidocaine toxicity. What will happen in lidocaine toxicity? What will happen to the CNS? Is it a post-excitation depression or the post-depression excitation? Who will say what will happen in lidocaine toxicity or lidocaine toxicity? Post excitation depression or post depression excitation. Now, anaerobic bacteria is not given for intrinsic resistance to aminoglycosides because aminoglycosides require oxygen for action. Aminoglycosides require oxygen for action, and without oxygen, aminoglycosides cannot be given for anaerobic bacteria. Aminoglycosides cannot be given for anaerobic bacteria. Now, guys, please remember Listeria has natural resistance. Listeria has natural resistance to cephalosporins and Mycoplasma. Mycoplasma has natural resistance to cell wall inhibitors. Right? So, Mycoplasma has natural resistance to cell wall inhibitor and Listeria has natural resistance to cephalosporin. Right? Now, here, guys, you people have to answer me like meropenem. Now, I would like to ask which carbapenem is never given as a monotherapy? Which carbapenem is never given as a monotherapy? It's always given with some other drug, never given as a monotherapy. Yes, in the previous question, you people have marked it correctly. Lidocaine can cause post-excitation depression. Post-excitation depression is the answer. Now here you have to answer me which carbapenem is never given as a monotherapy. What is the name of a carbapenem which is never given as a monotherapy? Now guys, niacin is an outdated medicine. Maybe in 2018 this drug was used, but now not in 2024. So niacin is cautiously used in insulin resistant diabetic patient. Why? It's not a valid question, I think. It can further increase the insulin resistance. It will further increase insulin resistance. This medicine can result in diabetic complication. This medicine can result in diabetic complication like acanthosis nigricans. This medicine can further increase a diabetic complication like acanthosis nigricans, can result in more insulin resistance. As a result of that, patient will have more hyperglycemia. Yes, in a previous question, the answer is imipenem. Imipenem is never given as a monotherapy, always given with cilastatin. Always given with cilastatin. So niacin, maybe it was used in 2018, but it's an invalid question these days. Now here guys, you have to answer what is the drug is useful for which drug is useful for hypercholesterolemia, and that medicine is ATP citrate lyase inhibitor. The medicine which is ATP citrate lyase inhibitor given for hypercholesterolemia and will not cause myopathy as a side effect. So if any patient who cannot tolerate statin, that ATP citrate lyase is inhibitor because that will not cause myopathy. You have to answer me the name of the drug, which is the ATP citrate lyase inhibitor. Now, sacubitril, guys, we have covered. It's a neprilysin inhibitor. Sacubitril is neprilysin inhibitor, which is given as a part of ARNI. Now, ARNI is a medicine that we have already covered. This is a combination of valsartan plus sacubitril. So, guys, here you have to tell me the important side effect of sacubitril. What is the important side effect of sacubitril? Yes. So, we people have already covered the ATP citrate lyase inhibitor is bempedoic acid. So bempedoic acid is a medicine that will not cause myopathy. It's an advantage of a statin. Now here you have to tell me what is the side effect of sacubitril that we have already covered in one of the previous question. Side effect of sacubitril we people have covered. Now antihypertensive contraindicated in PIH. Which antihypertensive is contraindicated in PIH? So we have already covered that there are two group of antihypertensives. There are two group of antihypertensives which are contraindicated. One is the medicines inhibitor of RAS pathway, renin-angiotensin pathway, like AC inhibitor ARB. And we have also covered one more group of medicine that is contraindicated. But in this MCQ, atenolol is an option that you will mark. So these three medicines are safe where the labetalol is a drug of choice. Like in one of the previous question, we said that atenolol can be given. Atenolol can be given when the benefit is more than the risk, then it can be given. But in this question, I'm ruling it out because other three medicines are safe. Now here you have to answer which medicines are purely contraindicated in PIH. One is the medicines inhibitor of RAS pathway, like AC inhibitor ARBs or RAS pathway inhibitor. One more. There is one more group. One more group of medicine, I'll give you a hint. That group of medicines can lead to loss of water from the body. And because of loss of water from the body, that group will cause oligohydramnios. And because of oligohydramnios, the fetus cannot survive. Now, tadalafil, sildenafil, these medicines are phosphodiesterase enzyme inhibitor. And by inhibiting phosphodiesterase enzyme, they can increase the level of cyclic GMP and can result in erection. Can result in erection. They are the best medicines for erectile dysfunction. So one of the important side effects of this medicine is hypotension. And because these medicines can cause hypotension, we should not use these medicines along with along with vasodilators. Right? We should not use these medicines along with vasodilators. Yes. Doctor NEET PG, if the pregnant female is having CHF with pulmonary edema, if a pregnant female is having CHF with pulmonary edema, then this is not a case of hypertension. I told you that hypertension mein these medicines are contraindicated, like the RAS inhibitors and diuretics. But now the female is having CHF with pulmonary edema. If you will not save her, she will die. So in that case, you will not think about fetus. You sacrifice the fetus. So here again, you will mark the medicine as furosemide. So here you have to save the female life. Here you have to save the female life. That's why the condition is changed, na guys. That's why there was a time, there was a classification of drugs that are safe in pregnancy. Like we used to say class A medicine, class B medicine, class C medicine, class D medicine, class X medicine. Now this classification has been removed. Why they have removed the classification? Because like furosemide, if we take the example, now furosemide is contraindicated in pregnancy when the female is having hypertension. Now same furosemide become the drug of choice if the female is having acute CHF. So it's difficult to say in generalized manner, like which medicine is safe, which medicine is unsafe. That's why these people have removed this classification of safety in pregnancy. They just tell you which drugs are safe in a particular disease, which drugs are unsafe in particular disease. Right? So question number 7, answer is A. Now, which medicine require regular monitoring? So guys, lepuridine is an old medicine. This medicine can induce antibodies. This medicine can induce antibodies which can neutralize this medicine action. That's why this is the old outdated medicine which require monitoring. So this question is asked this time in AIMS exam also. But this time in INS-CT May 2024. So INS-CT May 2024, the same question they have asked. So lepiridine is the answer again this time also. Question number 8, answer is B. Right? Question number 9, can you see guys, this is I think 7th question we are doing on, 7th or 8th question we are doing on antiplatelets and anticoagulants. Apixaban, again the medicine is having the factor 10A ban. It's a factor 10A inhibitor. Now this apixaban, like in the previous drug we people discussed, rivaroxaban. Rivaroxaban should be taken after food. Regarding this medicine guys, please remember, this drug is safe to use in CKD. This medicine is safe to use in CKD. This medicine is safe to use in CKD. It's a factor 10A inhibitor. Drug name is apixaban. Now, colchicine. This is the third question we are doing on the colchicine. What is the mechanism of colchicine in gout? So, it inhibits the multiplication of WBC. Also, this medicine can stop the migration of WBC. So, this medicine can stop the multiplication of WBC as well as stop the migration of WBC. Now, you have to answer me why this medicine is given along with allopurinol. Why this medicine is given along with urate lowering drugs. So whenever we have to give urate lowering drugs, why this medicine is given along with them? Anyone can answer? Anyone can answer why we give this medicine along with allopurinol? Question number 11. Which drug can prolong the QT interval? So guys, we discussed already. Q stands for quinidine. This will cause QT interval. We have one more medicine, procainamide. So procainamide will prolong the QT interval. So quinidine will cause QT prolongation. Procainamide will prolong the QT interval. Lidocaine, guys, we already discussed. This will cause post-CNS excitation, post-depression. This will cause CNS excitation first, then the depression. Ciprofloxacin, we have discussed already. It's a fluoroquinolone. Propranolol is generation 1 beta blocker. We have discussed already. Yes, so Dr. Mobashri Mohammed, we give colchicine along with these medicines to prevent inflammation. Try to understand this is a prophylactic drug. In acute gout, it is an anti-inflammatory, but in along with urate lowering drugs, this is as a prophylactic drug. Please remember the role. Role is different. In acute gout, drug of choice is NSAID, but prophylactic drug of choice is colchicine. Difference है दोनों में. Be careful. Now, what is the definition of PKA? And I don't know why these people have asked this question in 2018. So 6 years back, we are discussing the questions of 6 years back. At that time, the level was low. Now you people are very smart enough to know the answer. PKA is a pH at which 50% drug is ionized, 50% drug is non-ionized. Question number 13. Centrally acting medicine, which is alpha-2 agonist and used as a muscle relaxant. Alpha-2 agonist used as a muscle relaxant. The drug is tizanidine. So tizanidine is a drug. Baclofen is also a medicine that will act on GABA B receptor. It is also used as a centrally acting muscle relaxant. So tizanidine will act as a muscle relaxant and baclofen will act as a muscle relaxant, and this is also a centrally acting muscle relaxant. So these are the three medicines which we use as a centrally acting muscle relaxant: baclofen, tizanidine, chlorzoxazole. Now, pyrazipine is a muscarinic 1 receptor blocker that we use for peptic ulcer disease. It's a muscarinic 1 receptor blocker that we use for peptic ulcer disease. So question 13, answer is D, Delhi. Question number 14, which drug is corticosteroid inhibitor? The drug is metirapone. So metirapone is a medicine. It's a 11 alpha hydroxylase inhibitor. It's a 11 alpha hydroxylase inhibitor. It's a second drug of choice. Second drug of choice for Cushing's disease. Second drug of choice for Cushing's disease is metirapone. What is the drug of choice for Cushing's disease? Drug of choice for Cushing's disease is ketoconazole. So drug of choice for Cushing's disease is ketoconazole. Second drug of choice for Cushing's disease is metirapone. Now finasteride is a drug which is a 5-alpha reductase inhibitor. We use this medicine for BPH as well as this medicine is given for androgenic alopecia. Now mifepristone is a drug for MTP. It's a progesterone receptor antagonist, right? So metirapone, second drug of choice for Cushing's. Ketoconazole is drug of choice. Question number 15. All of the following are the bacteriostatic medicines except. So guys, please remember cell wall inhibitors. Cell wall inhibitors are bactericidal. Cell wall inhibitors are bactericidal, but the medicines which are protein synthesis inhibitors. Medicines which are protein synthesis inhibitor, these medicines are bacteriostatic. So protein synthesis inhibitors are bacteriostatic, except, protein synthesis inhibitors are bacteriostatic, but vancomycin, cell wall inhibitor, it's a bactericidal. Question 15, answer is A. Question number 16, which of the following statement about prasugrel is true as compared to clopidogrel? So guys, at that time, prasugrel was a different sense. Mobashri flutamide. Flutamide is an androgen receptor antagonist. Any drug that ends with the word glutamide, any drug that ends with the word glutamide is an androgen receptor blocker, and these are the anti-cancer drug. And Dr. Mubashira Mohammed. So basically, क्या है कि any drug which is an anti-cancer drug is not important for NEET exam because there was a time when examiners used to ask these medicines. But now recently what has happened? We people have developed a different approach to treat cancer. We people have developed the targeted chemotherapy. We people have developed immune checkpoint inhibitors. So all these old cancer drugs have become outdated and they have stopped asking questions on these medicines. So this is a less important topic, anti-cancer drugs. Even you have seen, like we have not attempted any question on anti-cancer drugs. In NEET exam, anti-cancer topic is less important. Only you should be knowing how to manage the side effect of anti-cancer drugs. So guys, when the prasugrel was approved, right, at that time it was considered as this medicine. This medicine has a very high potency. Yes, so this medicine potency was very high. It's a very potent medicine. The potency was very high. So it has a more risk of bleeding. So this medicine used to have the more risk of bleeding. And still it is considered as because of the high efficacy than clopidogrel, the new medicine prasugrel. Because of the high efficacy, this medicine has high risk of bleeding in comparison to clopidogrel. Now, clopidogrel, prasugrel, they are the irreversible inhibitors. They are not the reversible inhibitors. They are the irreversible inhibitor. Clopidogrel, prasugrel, ticlopidine. These are the irreversible inhibitors. Now, because of this high risk of bleeding, when this drug was launched, I still remember the day when I used to teach the students, hey guys, we will not give this medicine in patients of stroke. We will not give this medicine in patients of stroke because the drug is highly efficient, can lead to more risk of bleeding. But with time, we people have started using this medicine. With time, we have started using this medicine for the stroke also even. So this question has become invalid, but in 2018, this question was valid, right? Question 16, answer is B. Now, what is serotonin and why they are putting the biochemistry questions? Serotonin is 5-hydroxytryptamine. Serotonin is 5-hydroxytryptamine. Answer is A. Question 17, answer is A. What is the physiological role of hydrocortisone? What is the physiological role of hydrocortisone? Physiological dose. So guys, in human body, cortisol is released daily 20 milligram per day. So it is released 20 milligram per day. So 20 milligram of cortisol is released daily in body. So if you are not a person who take lot of tension, If you're not a person who take lot of stress, then daily in your body 20 milligram of steroid is released, right? So 20 milligram of steroid is released if you are not a person who take lot of stress. So here the answer is they're asking the physiological dose 20 milligram, not per kg. So 20 milligram per day. 20 milligram per day is released, right, guys? But if you take lot of stress, more steroid hormone is released. So take less stress in the life. Pyranzapine we have already covered. It's a muscarinic 1 blocker. We use it for peptic ulcer disease. We use this medicine for peptic ulcer disease. Question number 19. Answer is A. Question number 20. Which medicine can cause melanosis coli? So drug is Senna. Now Senna is a laxative. This medicine is given for constipation, and this medicine can cause hyperpigmentation of colon. Hyperpigmentation of colon, we call it melanosis coli. So Senna can cause melanosis coli. When you do the colonoscopy, then you see this kind of dark color colon from the inside, from the inner side. That is Senna side effect, melanosis coli. Now, which of the following is the best choice of antibiotic for a bedridden patient with catheter-related UTI and pneumonia? So this is a hospital-acquired, guys. Hospital-acquired infection having the UTI plus pneumonia. So guys, we know that patient is bedridden. Patient has got two infection. So this is not controlled by beta-lactam antibiotics with beta-lactamase. Basically, both options are there. We can give third generation cephalosporin. We can also give amoxiclav like in this MCQ. Plus, along with that, we can give the medicines like fluoroquinolones. We can give the respiratory fluoroquinolones because the patient is also having the pneumonia. So to cover both pneumonia as well as UTI, we have to choose a medicine that will cover both. So guys, as per the guidelines of pneumonia, this is the regimen that we use for pneumonia, and the same treatment is also applicable to UTI. Same treatment is also applicable to UTI. So here you will choose third generation cephalosporin because this is a hospital acquired. You suspect the pseudomonas, and the third generation cephalosporin, like there is a drug ceftazidime. Ceftazidime is a third generation cephalosporin. This is a drug of choice for pseudomonas. So in a hospital admitted patient, here in this case, we will try to cover the medicine that will cover pseudomonas. So like Dr. Shimu is answering azithromycin. Azithromycin Shimu is not effective against pseudomonas. I will choose here the levofloxacin. Because this will cover both pseudomonas, UTI bacteria plus the pneumonia bacteria. It will cover both. So question 21, answer is C. Question 22, nitric oxide acts by increasing cyclic GMP. It acts by increasing cyclic GMP. This is a fact-based question, nothing important. I mean, it's important, but nothing, special here. 22, answer is D. Areva, it's finished. So success is not final. Failure is not fatal. It's a courage to continue that counts. So guys, keep on doing hard work. Keep on maintain your focus and keep your momentum with you, and bet you the success is all yours. So guys, with this, I'm just signing off, your pharmacology guru, Dr. Saurabh Bhatia, and my all wishes are with you guys. All the very best for your exam, and I really want to see you successful. I really want to get your message like, sir, we have got this rank. That will be a best moment of my life when you people get selected, my students get selected. So guys, all wishes with you. Take care. Good night.